Okay, thank you very much, everybody. This is a call to order to start the conference, and I would really like to welcome everyone, our friends from all over the globe, to this conference. And as you all know, that this is the first international conference by South Asia Democracy Watch, and we are very happy to focus on the issues of the women in the South Asian region. As you all know that there are tons of issues regarding the women and their rights and their health uh, in those countries. Even though we see that there are two of those countries are atomic powers, but their investment in human capital, especially on the maternal health and children, is dismal, frankly speaking. So we would really like to focus on these issues. And we are going to have two sessions. The first session is going to be related to health. And in the second session, we will be focusing on many other issues. So I would really like to uh, uh, everybody to be on mute unless and until you are talking or speaking, unless you are speaking to the conference. And at this point, I would really like to invite our executive director, Dr. Qasir Abbas, to address the conference. And let me introduce him. Dr. Qasir Abbas, one of the founders of South Asia Democracy Watch, is currently its executive director. He has served several American universities as professor, assistant dean, and director. He has recently co-edited a book named From Terrorism to Television, Dynamics of Media, State, and Society in Pakistan, Routledge 2020. So without further ado, ladies and gentlemen, Dr. Qasir Abbas.
Qasir Sahib, you're muted.
Yeah, are you hearing me?
Yeah.
Okay. Well, thank you, Aftab Saab, for nice introduction. Welcome to the South Asia Women's Conference. Good morning, good evening, good afternoon, wherever you are. You might have seen Prime Minister Imran Khan's recent comment when he said women are sexually assaulted because of the dress they wear. And you can imagine what kind of impact it would have when a nation's leader blames the victim like this. It is against this backdrop that we have organized this women's conference. The conference will take a critical view of these issues in its two sessions and raise voices for gender equality in our society. Activists and scholars from Afghanistan, India, Pakistan, Nepal, Bangladesh, and the US are participating in this international conference. I would like to thank these participants who have developed their time, who have devoted their time and expertise to make this important conference a great success. I also thank the conference committee, including Aftab Saab, Aftab Siddiqui, who's the chair of the conference, Amreen Khan, Sayyida Aroob, Iqbal, and Fayyaz Hassan Saab, who is providing the technical assistance for the conference. They did a wonderful job in organizing this international conference. Thank you, everybody, and back to you, Aftab Saab.
Thank you very much, Dr. Abbas, for joining us and welcoming the participants. Now, I would really like to talk a bit about the about our organization. And once again, ladies and gentlemen, good morning, good evening, and good afternoon, depending on where you are. Uh, Thank you for joining us at South Asia Democracy Watch's first international conference on women. South Asia Democracy Watch is a nonprofit organization with a mission to monitor democratic systems and processes in South Asian countries. It works to communicate research, data, and analysis to its US, global, and South Asian audiences. Our vision is to become an internationally recognized and impartial group to promote and nurture a culture of democracy and social equality in South Asian countries. Our objectives are to monitor democratic processes and systems in South Asian countries, to nurture a culture of democracy through educational, cultural, and literary programs and events, to communicate democratic values in the region on social tolerance, freedom of expression, justice, fairness, and equality to a broader American, South Asian, and global audience through the modern channels of communication. I would like to thank the distinguished speakers, especially Dr. Shershaw, who connected me to so many of the people who will be sharing their ideas and experiences with us today. My special thanks to the conference committee that also includes Sayyida Arub Iqbal, Amreen Khan, and Syed Fayyaz Hassan. We have come a long way since we started working for the conference 7 months back. The conference would not have happened without their help. At this point, I would like to recognize the board members. Our president, Mr. Amir Makhani, board members, Raja Muzaffar, Amreen Khan, Zahid Khanzada, Tausif Kamal, Sayyida Arub Iqbal, and Syed Fayyaz Hassan. The South Asian region consists of Afghanistan, Bangladesh, Bhutan, India, Maldives, Nepal, Pakistan, and Sri Lanka. Its population is approximately 2 billion and encompasses a land of approximately 2 million square miles. Okay, sorry about that. In America, we are still on miles. We don't talk about kilometers, unfortunately. Maybe that is the American exceptionalism. I don't know. It is the region is very diverse in ethnicities, religions, languages, and has a rich cultural and historical heritage. South Asia Democracy Watch has organized a number of informative events to highlight the issues in the region. Our first conference was on minority rights in collaboration with SMU, the Southern Methodist University. Another event was on the issue of gendercide in collaboration with Gendercide Awareness Project and University of Texas in Dallas. The keynote speaker was Nobel laureate economist Amartya Sen. The organization holds an annual lecture series on human rights in collaboration with Wilson Center in Washington, D.C. The lecture series is named for late Asma Jahangir, who was a well-known human rights activist in Pakistan. So I would really like to ask Ms. Arub Iqbal to introduce the first panel.
Thanks a lot, everyone, for joining today. I'm Arub. I am also a board member of South Asia Democracy Watch. We have an excellent lineup of speakers today for our first session, Healthy Women, Healthy Society. And I would like to introduce our esteemed speakers today. We have today with us Dr. Suraj Bhandari from Nepal. Dr. Suraj is a leading obstetrician and gynecologist in Nepal with interest in public health and reproductive medicine. She has worked in a number of countries in Asia to help develop healthcare systems in relation to women's reproductive rights. She has worked with Johns Hopkins University and other international agencies in the area of healthcare for women and girls. Dr. Raj Bhandari is a founding member and past president of the Nepal Society of Obstetricians and Gynecologists. In addition to her work in Nepal, Dr. Pradhan has worked in Pakistan, Cambodia, Malawi, Indonesia, Jamaica, India, Afghanistan, Bangladesh, Yemen, Myanmar, Laos, and Fiji. So, a truly global experience she brings. We also have Dr. Bilqis Begum from Bangladesh. Dr. Bilqis Begum is a women's rights activist, an experienced obstetrician and gynecologist who is playing an important role in the life of rural women in Bangladesh. She's a fistula surgeon and an active member of International Society of Fistula Surgeons. And we are very pleased to have her here today. Nazifa, the third speaker that we have is Nazifa Hamra from Afghanistan. Dr. Nafiza Hamra is a gynae surgeon working in Malalai Women Hospital in Kabul, which is the biggest hospital for women in Afghanistan. She is an excellent fistula surgeon and organizes fistula repair camps in different parts of Afghanistan. And it is great to have her here today with us. Fourthly, we have Jaspreet Mahal from India. Jaspreet Mahal is working as an accessibility specialist at Brandeis University with student accessibility support. He was a Fulbright scholar from India from 2015 to 2017. He works for social justice and equity and works to bring the voices of the marginalized communities to the forefront. We are also very grateful to Dr. Shesha Sayyed for moderating our first session today. Dr. Shesha Sayyed is a gynecologist with a special interest in maternal health and genital tract fistula. He's a doctor focusing on women's rights and human rights. Additionally, he's a writer and has written a number of books in Urdu literature. Without further ado, I will hand over to Dr. Shesha to lead and open the first session.
Thank you for a very good introduction of the session. I think better we do not waste any time and start the session. And as per program, I see it has to be starting with me. So I'll be talking about the health issues in Pakistan, and health issues in Pakistan is a topic on which you can talk whole day and another day, but we are only focusing on the women's health. And talking about women's health, I must start with the initial statement given by Siddiqui Iqbal Saab regarding the statement from our Prime Minister Imran Khan, when he said that women are victims of violence, especially the sexual violence, because they are wearing clothes which is provocative. And this is not his own attitude or his own thinking. Actually, he is representing the thinking of the people of the country, especially the men. Recently, in last 2-3 weeks, there are a lot of things happening in Pakistan, especially the sexuality of the mullahs and the men who are involved in sexual violence and violation of the small boys in their madrasas and schools. And nobody even mentioned a single word that why these Maulvi Sahiban are violating young madrasa students when they are not even women or girls, and they're definitely not wearing provoking dresses. So that is one point. The other point is, if you want to understand the healthcare system in Pakistan, especially women, I will just give you the one example, which is genital tract fistula. We all know the genital tract fistula, VVF and RVF, is an act of violence against women because it is created when the reproductive rights of the woman are violated. It is a disease of the extremely poor woman. It is a disease which is occurring more in the young girl child, and it is the disease which is caused by the unavailability of basic obstetrical care and basic emergency obstetrical care for the girls. And why it's happening? It's happening because the society is insensitive as far as women are concerned. The society doesn't care as far as women's health, reproductive rights are concerned. The society is totally unsensitive regarding the health of the girl child and woman. Why is happening? Because the women are not valued in our society. In my province, which is Sindh, there is a saying that if a woman is dying or dead, it doesn't matter. But a cow should not die because cow is more important than woman. A man can have 1, 2, 3, 4 wives, but it is difficult to buy a cow when it's dead. So if the society is insensitive regarding the woman's health, that means the society's approach towards the woman's health. And this represents the whole situation of the woman in Pakistan. Women are a victim of violence. Women are victim of uh, sexual violence, and women are victim of physical violence all over the country without any exaggeration. Recently, just yesterday, there is a letter distributed in one of the province of Pakistan from the religious group saying that if they will see any woman wearing clothes which is not appropriate, they have a right to attack her, they have a right to throw acid on them, and they have a right to kill them because they are creating problem in the society. So health issue is not really, women's health issue is not really a health issue. It's a political issue. It is a issue to control the woman. It is a issue to suppress them, and it is a issue to rule and make them slave. And this is the reason I always give an example that why Fistula Foundation California and United Nations Fund for Population are responsible to provide help for the repair of fistula in Pakistan. It is a disease of a Pakistani woman. It is the Pakistani government should be responsible to take care of these girls, but Pakistani government is insensitive to this gross violation of women rights, and it is totally unacceptable. So this is the real situation of healthcare for the woman in the country. And there are two very important things which is related to this condition. Number one, poverty. Poverty is very common. About 40% of the people are living under poverty level in Pakistan. And out of these 40% people, majority of the women are more poorer than the men. So if they are poor, they have no value in the society. Number two is the lack of education. Education is not available for the girls. I will give you a very good example. I'm sure our friend Saroj will tell us about Nepal. When you go to Nepal, you see that hundreds of young girls are going to school from city to village. And that shows the government is sensitive about the education of the woman. And if the woman is educated, she will stood for the right, she can talk about the right. And I will give you a very simple example that in 1921, Kemal Ataturk declared that in Turkey, no man can have two wives. This is not legal. And since that time, now it's 100 years, it's not possible for men to have two wives, which is a violation of the woman's right. And despite the religious attitude of Erdogan, it is not possible for him to declare that this is an un-Islamic law. because the women of the country are educated. They can stand for their right.
Well, did we lose Dr. Shesha?
Dr. Shesha, we cannot hear you. Maybe he needs to reconnect. Yeah, I think he got disconnected.
Okay. Let's give another minute and now we can continue with other speaker of the session.
Just a heads up, if anybody has any questions related to any of the, presentations or the speakers, you can always shoot the question in the chat. That would be great. And in the agenda, if most of you got a chance to read it, we have a question and answer panel that would be starting after once we'll finish with session number 2. And we will be having about 30 minutes for doing that. Wanda already has a question, and we should be able to reply later. Most of our panelists would be staying with us, so we don't have to worry about our questions being answered. We're back with Dr. Shersha. Looks like he's here. Thank you for reconnecting, Dr. Shersha.
Yeah, I think something was wrong in the.
You're back.
Well, anyway, to conclude, I will invite Dr. Saroj Raj Bhandari from Nepal to talk about the healthcare system for women in Nepal.
Thank you, Shesha. Good morning, good evening, and namaste to all of you from Nepal. I have some PowerPoint presentation, but I could not share. Would you be able to help? So I have been given the task. I'm hearing a lot of echo.
So we're also hearing a lot of echo. If 2 of your appliances are connected together to Zoom, you may need to switch one off. That may help.
Actually, I don't have to. It's only my PC.
We need some troubleshooting here, Vyasa.
Okay, let me check if I can share. Can you see the screen? Hello?
Okay, you're mute.
I'm not muted.
Yeah, we can hear you, but Vyasa is muted. So Raj, can you disconnect and reconnect again? Maybe that's going to help with the noise.
Yeah, that's what she should do.
Thank you. That'd be a great help. And
Yeah, let's Dr. Bhandari, you need to unmute, and I made you a co-host so you can share your presentation as well.
Did you share the screen?
Not yet?
Yes.
Yeah, share the screen with her, and then I think she will be able to.
Yeah, so she can share a screen. Okay.
Okay, I think.
Okay, Dr. Bhandari, you can share your screen too.
Okay. Where is my presentation gone? Share screen. Okay. Wow. This is not what I expected.
If we have technical issues, doctor, we can actually talk about it. How about that?
Yeah, I think my presentation is here. Let me try one more time. If it doesn't work, then I'll start presenting. Can you see my screen? Can you?
No, we cannot.
Okay, all right. Then I think I'll just start my presentation. The topic given to me was the health status of women for Nepal. And Aftab asked me to share the success stories and what is the status of health situation of women and the newborn in Nepal. Nepal is a beautiful country, but landlocked from three sides. North is China, east, west, south is India. And 2015, the constitution declared that the Nepal should be a federal democratic republic with one federal government, 7 provincial governments, and 753 local government units. And the federal government is responsible for the policy and the lawmaking, determining the quality and standards, and specialized services, research and developments. And the local level, the key responsibilities are local level policy, program related to health service management, basic and specialized health programs, coordination, and the monitoring and evaluation. So Nepal has a population of about 26 million, where the female population is more than male, and then the life expectancy of female is 71 years. Estimated annual birth year is 700,000. Nepal has committed to achieve sustainable development goal target 3.1 of reducing the global MMR to less than 70 maternal deaths per 100 live births by 2030. To achieve the ambitious target, Nepal will need to reduce its MMR by at least 7.5% annually, addressing severe inequities in maternal health access, utilization, and quality. The situation of maternal mortality in Nepal is that currently the maternal mortality ratio is 239 per 100,000 live births. We have come a long way since 1996, but to achieve the 70 maternal mortality ratio for SDG is quite a challenge. However, the childhood mortality looks promising because under 5 mortality, infant mortality, and neonatal mortality is looking promising. And I think we'll be able to achieve a reduction of neonatal mortality 12 per 1,000. So there has been several programs, policies introduced in Nepal since 1994. The Safe Motherhood Plan of Action was introduced, and female community health volunteers were introduced nationwide in 1988. And then 2002, the abortion was legalized. 2004, the safe abortion services introduced, and many community-based intervention, including CBMNCP, community-based integrated management of childhood illness, and the management of postpartum hemorrhage, prevention of infection were introduced from 1997 to 2011. The leap in the maternal health took in 2006 when skilled birth attendant policy was introduced, and that is when the maternal health started improving in Nepal. And the introduction of maternity incentive scheme, safe delivery incentive, and the AMA program is mother program, which provides a package to both the mother and the service providers if they do 4 ANC, institution delivery, and the postnatal care. Both the service providers and the healthcare workers and the mother, they get the incentives. In 2015, the free newborn care program was also introduced. Now, to improve the maternal neonatal health, all the policies and the strategies were in place, but I would say that task shifting was initiated to ensure that even the most vulnerable communities get access to efficient and equitable service delivery. And task shifting was done especially for doctors who are medical doctors. They are taught cesarean section, and the nurses and the health assistants were given the responsibility to become the anesthetic assistant, and the nurses were trained for the skilled birth attendant, even the auxiliary nurse attendant, to deliver the woman and manage and identify complication and refer in timely manner. So along with that, coaching, mentoring for these service providers was launched, because after training, they needed some support because not all of them were confident and competent to provide services. So the mentoring, coaching really helped. And social health insurance scheme of the government has been implemented at all 77 districts so that the health services is accessible to poor and marginalized and people in hard to reach areas. So thus, like in 7 provinces, we have referral hospitals and the medical colleges. And now within the provinces, all the women in complicated cases can be referred. So 46% of the health posts are listed as birthing centers, and 219 health facilities offer cesarean section services. However, neonatal intensive care unit is the weakest link of our system, because there are only 11 referral hospitals who can manage the serious newborns. As I've already mentioned, that the female community health volunteers are the pillars of our health system. There are more than 50,000 volunteers who are involved in the community. So what they do? They provide counseling services in the family planning, distribution of commodities. In safe motherhood, they create awareness, promotion of antenatal care, visit, institutional delivery, and they also explain danger sign, and they are also involved in the immunization and vitamin A supplementation. So we have achieved a lot in family planning services. Like our TFR has come down to 2.3 in 2016 NDHS, and our CPR is also, we have reached 53 in any method and 43 in modern method. However, the crux to this is that the rate of pregnancies is high and contraceptive use is low amongst teenagers. As child marriage is high, especially in province 2, and CPR among currently married adolescents is only 23% against the national average of 43%. Although adolescent health programs are introduced, but few and scattered adolescent family health clinics are not functioning well. So we have achieved in maternal health services that the first antenatal visit by the skilled health care provider is by 84%, and the 4 ANC visit as per protocol is 69%, and institutional delivery has increased to 57%. Along with this, there has been the strengthening of referral system and the linkages, especially the network of the roads, communication, mobile, transportation are considered as one of the best intervention which has been implemented after the federal structure. The local level are focusing on ambulance services, while in very remote areas, difficult terrain airlifting services are being utilized. The President's Program for Women's Upliftment initiated in 2018 and has made air medevac of 170 mothers who may not have survived if they did not get urgent hospital treatment. I wanted to show you some of the glimpses, but sorry, my slides are not working. So what COVID-19 has impacted our maternal and neonatal health? In spite of all the successes we have achieved in maternal health, pandemic has caused a reduction in health service delivery, especially during lockdown. There has been decrease in institutional delivery, increase in neonatal mortality, and increase in stillbirth. But with the pandemic, with all the challenges, there has been some activities in maternal health services during COVID-19 that Emergencies Helpline initiated to assist the rural M&A service providers in clinical decision-making during the COVID-19 pandemic. And that has really helped these rural service providers to be in touch with specialists, OBGYNs, MDGPs, and the advanced SBAs. Either they are able to manage there and then, or refer to the district hospital, or bring it to the center. So some of the challenges along with the success I want to share, like Shesha has mentioned, the maternal health situation is not all that bleak in Nepal. Although like if you compare the GDP, I think we are quite far behind, but I think there is a lot of political will to improve maternal and the neonatal health. In spite of that, there is underutilization of the health services because of the lack of awareness. There is social disparities because the wealthy quintile are accessing the health services. There is low socioeconomic status of women. I already mentioned that teenage marriage and the early pregnancy is an issue. Unsafe abortion still prevails in spite of the legalization of abortion. Only 40% of the population knows about the legalization situation, and they don't know which are the listed sites to go to get the services. And most importantly, inadequate human resource for health is an issue, and the quality of care is also questioned. So what has been the plan for the Nepal Developer Roadmap of 2030? Now it is going to focus upon the quality of services, especially on equity, and a particular focus on the specific needs of the community. And the special focus on the postnatal care services, because the maternal mortality and the neonatal mortality happens within 24 hours, whether in the facility or at home delivery. So all the activities to identify the danger sign in the postnatal has been implemented in 400 local municipalities. And especially PPH, postpartum hemorrhage, being the #1 killer, the intervention has been introduced in all 77 districts. And the capacity of local and the provincial governments to be enhanced for planning and monitoring, and the management of human resources is the key issue. And now we have developed midwives since 2016, and they are also deployed in several facilities. And hopefully with the task shifting, task sharing with midwives, nurses, skilled birth attendants, and all the specialists, MDGPs, and the advanced SBAs, with EDPs, NGOs, we will be able to achieve our SDG goal. In spite of the political instability in Nepal and the changes in the leadership, but the Ministry of Health and Population is taking a good leadership to improve the maternal and neonatal health of Nepal. Thank you very much for your patience hearing.
Thank you, Suraj. We will have some questions afterwards. So I will invite now Bilkis Begum from Bangladesh to talk about the maternal health and infant mortality in Bangladesh. Bilkis.
Thank you, sir. Thank you, sir. Share হচ্ছে না কেন?
Bilkis, I can hear you. You're
Yeah,
very
yeah.
Go ahead.
Yes, sir. এটা
Bilkis, you can start your presentation.
Hello.
Yes,
I want to show my presentation. Hello, can I show my presentation? Hello. I want to show my presentation.
Okay, now you can share a screen.
Yeah, I am doing, but
Yeah.
here is host disabled participant screen sharing.
You should be available now.
Something is wrong. Yeah.
No, do you have the share screen feature? Do you see?
Yeah.
And once
Okay.
you
Yes. Okay. Thank you.
We see the screen.
Thank you. I am Dr. Bilkis Begum, Associate Professor OBGYN and Fistula Surgeon from Bangladesh. My topics is maternal and infant mortality in Bangladesh. Honorable Chair and the distinguished person, welcome to all. Bangladesh, a Southeast Asian country, is a developing one. Presently, its total population is about 164 million, among which 46 is of women of reproductive age. Urban population is 38.2% and total fertility rate 2.3. Contraceptive prevalence rate is 62% and teenage pregnancy is 28%. Poverty rate of Bangladesh before COVID pandemic was 20.5%, and now it raises to 29.5%. Nutritional status of women of reproductive age, around 56% have normal BMI, only 12% are malnourished. Overweight is increasing day by day. In Bangladesh, presently, 70% of the total disease burden having non-communicable diseases, and among women ages and 18 and above, hypertension and diabetes is the commonest one, which have adverse effects on pregnancy outcome, and it is more in urban area. I am showing 5 slides regarding maternal health and newborn health coverage of Bangladesh. In Bangladesh, around 47% having 4 or more antenatal visit, and 82% have 1 antenatal visit. And it having facility deliveries around 49% and home delivery still 51%. Among the private and urban area, more having facility deliveries. It is less in public and rural area. Medically trained provider doing the deliveries around 53%, but still 35% deliveries are done by the untrained TBS. And the percentage of deliveries by the medically trained providers, lowest in the poorest country, it is only 28%, and highest in the wealthiest quintile, that is the 82%. Percentage of cesarean section rate is increasing day by day. It is now 2017, as per 2017 survey, it was 33%. Postnatal checkup also increasing, both for the mothers and for the children. Within 2 hours of birth, it was 52%. But women in rural areas and illiterate and poor are less likely to receive postnatal checkup from the facility. Infant and young child feeding and vaccination program in Bangladesh, initiation of breastfeeding within 1 hour of birth, 60%. Proportion of exclusive breastfeeding is 65%. Vitamin A supplementation among children about 79%, and 86% childhood vaccination have done. All this leading to decreased child and infant mortality. Global situation, maternal mortality. In Bangladesh, estimated maternal mortality rate is 173 per lakh live births. It is decreased over time. In Bangladesh, maternal mortality accounts for 13% of all adult female deaths. Still, hemorrhage is the leading cause, followed by eclampsia and pre-eclampsia. 7% death for abortion, and also others, that is C-section related complication or puerperal sepsis. Only 3%, that is obstructed labor, dramatically improved. Indirect cause remains same. Distribution of death, maternal death, but by timing relative to delivery, more than 2/3 death still occurred at postpartum period, and about 24% during pregnancy, only 7% during delivery. Risk in relation to socioeconomic status. Risks tended to be highest in the poorest household and lowest in the wealthiest household. And rural female are higher mortality than urban female. Infant mortality rate increased, it is 28.3 per thousand live births, and neonatal mortality rate 26 per thousand live births. Among the neonatal death, birth asphyxia and the prematurity is the major two causes, followed by pneumonia and serious infections. Among the post-neonate, that is 29 days to 11 months, pneumonia is the major cause, followed by diarrhea and then others. Trends in childhood disease between 2011 to 2017. Serious infection has reduced significantly. Pneumonia also decreased, but prematurity over time increased. Birth asphyxia remained unchanged. Trends in teenage pregnancy over time has been reduced, which was from 1993 to 2007, 33%, now 28%. But it is still more common in rural areas and in poor and low educated groups. Birth interval in Bangladesh is long. Only 11% birth takes place within 2 years of previous birth. But percentage of birth interval less than 2 years is highest among the teenage group. This is under 5 mortality relation with the social status. In the poorest group, it is 55 deaths per thousand live birth, whereas in the highest wealthiest group, it is 36 deaths per thousand live birth. So Bangladesh has been steadily progressing towards reducing maternal mortality and infant mortality. Maternal death rates highest in the poorest household, higher in the rural areas, and 2/3 deaths occurred at postpartum. So to reduce the maternal and infant mortality, intervention to be made to improving in the healthcare delivery system, structural intervention, increasing interaction between the service providers, mothers, and the family members, and periodic regular periodic maternal and infant death audit and surveillance is the utmost important factor. So to improve the healthcare delivery system, quality antenatal care or at least 4 visits should be ensured in all pregnant women, which is only 47%. Skill delivery should be raised, and supervised government-initiated community-based skill birth attendant program should be strengthened. In low-resource setting, to prevent PPS at home delivery, use of oral misoprostol is effective. An essential newborn care practice should be ensured at all childbirth. Postnatal care should be covered, especially the non-facility deliveries. We have to reach the basic emergency obstetric care in door-to-door by the community health workers. This is a challenging factor that is establish an effective referral system with poor documentation at its level. It is difficult to establish. Others, good quality obstetric services at all levels is to be ensured, which is still poor in the rural area. Refresher training of the service providers is necessary, and periodic audit of the existing healthcare services and with accountability and reward is utmost important. Structural intervention in Bangladesh, literacy rate increased both in female and male. Still, it should be increased as because direct obstetric deaths are detected high among the low educated, poor and rural people. Adequate health budget allocation and implementation is utmost important factor. In Bangladesh, half of deliveries occurred at home, of which 35% by untrained TBAs. So community participation is utmost important. Integration of TBAs with the formal health system is an essential intervention. Simple training of TBAs regarding the recognition of danger signs and early referral can save many lives. So a linkage between community health service providers, mothers, and the other family member may play crucial role in reducing the maternal and infant mortality. In Bangladesh, to provide primary health care, Bangladesh initiative to reduce maternal and infant death in low resource setting. In Bangladesh, to provide primary health care, more than 13,000 community clinics has been established, which is located in easy to reach areas and can provide health services to around 6,000 rural population. It also provides health education services to the community members. The demand side financing scheme has been piloting since 2007. It is now implemented in 94 primary and secondary facilities with encouraging impacts. Essential newborn care practices is being trying to establish at all non-facilities deliveries. And helping babies breathe, a low-cost, low-tech program on newborn resuscitation has been spread all over the country. Still challenges. So to challenges overcome, to include the people living below the poverty line within the healthcare facilities. To establish a health safety network for the poor people is also a challenge. And to strengthen the appropriate quality emergency obstetric care in rural areas. To build up the awareness to accept the evidence-based pregnancy and childbirth care instead of old taboos. And last of all, regular periodic maternal child death audit and surveillance to find out the causal factors and appropriate intervention is a great challenge. Thank you all.
Thank you, Bilqis.
Thank you, sir.
I don't see Nazifa. Is she there? Nazifa Hamra from Afghanistan. Aftab, I don't think she's there. Is she?
No, I don't
Nazifa?
see her either. Amreen, Fayaz, do you see Nazifa? I don't see. Yeah, okay.
So if Nazifa is not here, then we can ask our friend from India to talk about, sorry. Yeah, it's Jasprit Mahal. Am I right?
Jasprit Mahal.
Jasprit.
Jasprit Mahal. Sorry about this mistake. So you are talking about the healthcare for women in rural India. I'm sure it will be very interesting as the women in rural Pakistan are really miserable. So Jasper, thank you.
So a little heads up for Jaspreet, because we do not have Dr. Nazifa with us. So Jaspreet Mahal is a colleague from Brandeis and Brandeis University, Massachusetts. And she has a great profile working. I love the way she introduces herself as Ambedkar feminist, and that just, that is something fascinating. We met a few years ago. And since we met, I was blown away by her profile. Thank you, Jaspreet, for joining it. And sorry for asking you to be a little early than your presentation.
No worries, no worries. Hello, everyone. So I'll just go with screen share, Ambreen. Is that okay?
Yes. Okay, so you're co-host, so you can, now you can screen share. Yes, there we go.
Okay, perfect. Can everybody see my screen and hear me okay? Great. Hi, good morning, good evening. I'm Jaspreet. Thank you, Ambreen, for that very kind introduction. I work at Brandeis and I am really, really happy to be here. This is a great effort in a wonderful direction. I'm originally from India and I've been in the US for a couple of years and I work with students primarily. But I've worked in healthcare sector in India for about 7-8 years. I was working in the eastern part of the country, specifically on maternal and child health. And so that is what my presentation is going to focus today. I want to start off with my own positionality in this whole aspect. As Ambreen kind of introduced me, I'm an Ambedkarite feminist, and I very, strongly believe that if you are a feminist, you would believe in Dr. Ambedkar's ideas. Dr. B.R. Ambedkar, who is the father of modern India, as I like to call him, and he wrote India's constitution. He was the first law minister. A person who's very progressive, and I believe that his ideas are very akin to feminist ideas. I'm also a public health professional. I have a degree in Masters in Public Health from India and have worked in that space for a while. And now coming to my own personal experience, I am currently pregnant. And so, the whole situation of understanding what maternal health looks like has come in a very different way to me right now. So I'll touch a little bit upon that as well. So what does maternal health look like? We have heard the earlier presenter talk about this. It is pretty bleak. We know that there are a lot of complications. There are a lot of deaths every day. And, the risk of women dying in a low-income country in South Asia, countries like ours, is really high. And the most unfortunate part of that is that nearly all of these mortalities come from our countries, and they're also preventable. And just to focus a little bit more about why we are talking about maternal health in India, India and Nigeria account for 1/3 of maternal health, maternal deaths. This is like 2015 data. And I want to close the slide with Dr. Muhammad Fatullah's quote, which he gave in World Conference in 1997 in Copenhagen, that women are not dying because of a disease we cannot treat. They are dying because societies have yet to make the decision that their lives are worth saving for. So I think with this conference, what we are trying to get is their lives are worth saving for. Yeah, and then coming to social determinants of maternal health in India, specifically, we know, economic status, gender, education, geography, all of those things affect, women's health in so many different ways. There is so much intersectionality here. It's not just the gender which affects, it's also gender in education, it's also gender in economic status, it's also where you are based. If it's a woman in a tribal hilly area where it's difficult to reach, the services are difficult to reach, it's very difficult to get there, and those women suffer more maternal deaths as compared to women in the urban area where there are more, practitioners available. And then one of the things which I have highlighted in red here, which is the social status or caste, and which is very specific to our countries. And by our countries, I mean South Asian countries. And that is something which is not focused enough in the sphere of health in general, but not in maternal health at all, is that social status actually has a huge role in how services are accessed, services are available to communities, and how they are able to avail of those services. It's not just affordability, it's access. So I'll talk a little bit more about access later. So again, maternal health or health is not a medical event, it's a social event. That's what I believe. Coming to National Rural Health Mission, I'll do this very quickly. I know I run a little late on presentations mostly, but this is like the goals of the mission. This started in 2013 in India, and it has been, increasingly being pushed forward. We also started a National Urban Health Mission, which started, and the basic goals have been reduction in infant mortality, maternal mortality, all of the health issues, communicable diseases, population stabilization, as I just put on the slide. Now, looking at the gaps, so this review was done in 2015. 2015. So when the National Rural Health Mission started, there were some gaps existing in the communities. There were, especially the spending part was really, really minimum. It is still really minimum. It's unfortunate that our countries can spend money on war, but they cannot spend money on maternal health. And that's the thing that we need to emphasize. There is a very poor convergence and coordination among different departments at the field level. From my own experience working in villages, I've seen the village level health workers, the ASHAs and the Anganwadis, they are there. There are, social welfare department workers on field. There are sanitation department workers on field. And they're probably working for the same cause in their own ways in different, aspects, but it just doesn't converge really well. It doesn't bring all of those vertical programs together, which is a huge gap in our system. And so, that's another big part of gap analysis for our National Rural Health Mission. The next one I'm going to talk about is this whole cycle of rural poverty. So, people go to the doctor, they have out-of-pocket expenses. They have to pay out of their pocket. They don't have the money for it. They need to borrow money for it, and then they go into indebtedness, which is a huge aspect which leads to poverty among rural communities. And then, specifically about caste, Dalit communities, it's, as I said, according to these two studies, it's a likelihood that the the nurse or the trained birth attendant is not there during their birth 5 times, that's the likelihood, 5 times. And then the behavior towards them while they're giving birth is really sad. I've seen that with my own eyes, the way they are being treated. There is a lot of untouchability which is being practiced in the hospitals, which I don't think that is something which we should be dealing right now. But unfortunately, that is the true situation, at least in public health facilities in India where I've worked. Now, looking at maternal health scenario real quick in India, this is 2015 and 2017 data. And if you look at the average of the results, which is the last column in India, you will see that that average is so very different and so much less than the scheduled caste or Dalit community indicators. So let's pick up just one of the indicators. If you want to look at infant mortality. So infant mortality, 45.2%, which is so much more than the Indian average, but also if you look at the gap with other castes and scheduled caste or Dalits, that is a huge gap. So when we are talking about improving maternal health or focusing on maternal health, if we are not talking about these gaps, and this was really a difficult data to get. This was not something which was existing in one of the studies which I picked up and put on the slide. This was actually effort to get this data together. So you see that if we are not focusing on this gap in the programming aspect, there is no point that we can improve maternal health in India. And I'm pretty sure that is true for all of our South Asian countries. Now, looking at right to health, and that's what I approach, the whole framework from, the right to health approach, and AAAQ, which is the availability, affordability, accessibility, and quality framework. This is a framework which, UN works with, and this is the framework that needs to be put in place in order to enable the marginalized communities to have access to health. And I have adapted that framework, the 4 aspects of these framework with cost. So if you look at the availability of services, how is that affected? So if folks have been to rural areas and they've seen this, there is segregation due to habitation. The communities, Dalit communities, are pushed outside of the village and they live on the margins, which is again unhygienic, and their access to services is restricted because of these segregation. Coming to affordability, of course, due to like the 5,000-year-old caste system that is in place, there is no way that these communities can, gather in capital. They don't have capital, and the income is really poor because they are restricted to very certain occupations that they need to do in order to survive. So if a health concern comes up, they run into that vicious cycle of indebtedness. Coming to accessibility. Now, accessibility, as I mentioned before, is very different from availability. This is discrimination in the labor room, in the delivery unit. This is the nurses not touching the Dalit woman when she needs a stomach checkup. This is not checking them if they are having a postpartum hemorrhage. And that also extends to children. So, not touching a newborn. So if they're not doing that, how do they know that the child has a fever? There is no way to do that. And then that leads to various mortalities and morbidities. And, regardless to say that leads to suffering of these women and children, especially in the scheduled caste communities. Now coming to quality. So giving all of that background about availability, affordability, and accessibility, if you think about any human being who's not respected at an institution, you would not want to go there. And I think that is something I've realized being pregnant myself in the US. Like here, the clinicians, the OB, the nurses, they are so respectful towards you. They don't put you down for asking anything, literally. And US is not a great system, by the way. We know that in the developed countries, US is worst in case of maternal health. And still those aspects of respectful maternity are there in US. So, you know, this shows something that like we have a long way to go. US has a long way to go, but we have a long way to go in those aspects. And that is what the quality piece talks about, where self-exclusion and poor quality of public health services go together with women. And then I want to bring you to a little bit of context of constitutional rights in India. It's not as if it is not in Constitution. It is very much available in Constitution. The right to health. There are directives, as you can see on the screen, which talk about maternity relief specifically, talks about nutrition level. It talks about, you know, strengthening the panchayats and public municipalities, which are the self-governing local organizations. So all of that is existing. And if you think of it, then what is missing? Basically, the will to implement that. That's what is missing. And that's what we need to be advocating for as, you know, public health professionals, as women's rights activists. Now, coming to recommendations, I think the first sentence kind of sums up everything I believe in, that health it should be honored as a right. And unless that is honored as a right, we will not be able to bring it to all the communities. There needs to be inclusive programming, specific programming for Dalit communities. We saw from the indicators that there is this huge gap between what maternal health indicators exist in other communities or dominant caste communities versus what exists in scheduled caste or Dalit communities. And unless that gap is filled through specific programming, it is very difficult that we will be achieving our goals towards you know, reduction in maternal and child health. There also needs to be adequate funding for healthcare costs. Whatever we say about, you know, US healthcare system, and their spending in GDP at least is 6%, which is almost almost like 6 times higher than India. So that's what you know, is an important aspect we need to think about. And then working on the field, I have seen that there is a huge issue with collection of data from the field, processing, evaluation, supervision. There is a penalized look or view of superior administrative folks, and which trickles down to you know, grassroots level workers not reporting anything at all, which is again a problem, because you want the data to be right. You don't want the data to be minimal. It needs to be right and minimal. So, you know, that's something we need to definitely work towards. And then I will leave you with Dr. B.R. Ambedkar's quote, where he says that I measure the progress of a community by the degree of progress which women have achieved. And I feel like unless we focus on women to, you know, be able to access, be able to do what they need, and get what they need with the proper programming, with the proper supervision, with having a say, having their voices heard in what they need, especially from most marginalized communities, we would not be able to progress. And yeah, I would like to end there. Thank you so much for having me here.
Thank you very much. Now I think we have a speaker from Kashmir, Khala Siddiqui, and she'll be talking about role of women in politics in Kashmir. Khala, please.
Thank you.
Sure. Thank you very much. One moment, please. Shasha, that is the second session.
Oh,
So,
okay, fine.
So,
Sorry about that.
no, thank you very much to all the speakers of the first session, and thank you very much, Shesha, for being the moderator. And I would really like to introduce the moderator for the second session. That will be Amreen Khan. She is a development practitioner and a fashion designer from the Valley of Hunza in the northern part of Pakistan. She completed her fashion education in Pakistan and established an all-women run clothing business that is operated as a social enterprise in Karachi, Pakistan. Through that, she worked for the marginalized artisan communities in the north and south of Pakistan. Her nonprofit Empyrean Foundation is successfully running programs for dressmaking and graphic designing, partnered with local organizations in Karachi, Gilgit-Baltistan in Pakistan, and Texas, United States, helping Afghan refugee women and domestic violence victims. Amreen is an active member of South Asia Democracy Watch and leading the women's chapter for the organization. Thank you very much. Amreen, it's up to you now.
Thank you so much, Aftab Saab, and thank you so much for all the speakers for the session one. Without you, we would have not have started on time. And this is an amazing morning. This is an amazing opportunity to share what we think, what our rights are. I would start with a wonderful quote of Michelle Obama, and that is basically dated from 2009, and she spoke on the State Department Women of Courage Awards. And she said that the difference between a broken community and a thriving one is the presence of women who are valued. And this is exactly what the initiative is about. It is not just about the modern or the educated women who are engaged socially, politically, and in the communities, especially in the South Asian communities. This morning, this conference is basically a step forward that so many people in our own communities, we can actually help, we can facilitate. You talk about health, you talk about economics, you talk about empowering them through any means. So without further ado, I would like to introduce you the session, and this is session number 2 of SDW Women's Conference, SDW Women's Conference 2021. And the session 2 is about nothing about us without us. So it is going to be about equity and equality of women in South Asian countries and how we all are becoming their voices. So our first speaker is Khala Siddiqui. And I am so thrilled to introduce her as one of the amazing women and activists. She's a senior consultant with Boston Consulting Group. She has done her MBA from Columbia Business School in Strategy and Entrepreneurship, and has BA with honors in Economics and Political Science. She's a consultant in consumer and private equity practice. She has designed product strategy for 1 billion European retailer, including target collection structures and new category development. So Khala also has co-founded NGO that's called Silk, presented at international conferences, including at the European Parliament. She is a consultant for Crafted in Kashmir, a women-focused social enterprise producing artisanal Kashmir products, founded Young Professional Network, a mentor program for the high school student. So she's one of the prominent speakers, the first speaker of the second session. Khala, the stage is all yours.
Thank you so much. Thank you for the invitation to participate today.
My name is Kaula Siddiqui, and I'm a Kashmiri. I'm living in New York. I'm a proud Kashmiri. I was born there and now part of the Kashmiri diaspora. And I'm so thrilled to be among a diverse set of women raising awareness for very important issues. I'm also very grateful for South Asia Democracy Watch and the work that you do, as a US-based organization to really keep a pulse on what's happening within South Asia and providing a forum to monitor, track how democracies are functioning in the subcontinent. So, the essence of a democracy is not really what's written in the nation's constitution, but how it functions on a micro level in society and whether it supports the freedoms and human rights of its people. And before I speak about Kashmir and the women's role in politics in Kashmir, I want to give a little bit of background and context, given that we have such a wide audience of people who may not be familiar with the situation and even where Kashmir is and what is happening there right now. So to give a little bit of background, Kashmir is a conflict zone that is currently claimed by 3 nuclear powers, India on one side, Pakistan and China. In 1947, during the partition and the creation of these countries of India and Pakistan, Kashmir was promised the right to self-determination, the right to decide whether they wanted to be part of India, part of Pakistan, or choose independence. It was done via plebiscite by the Kashmiri people who would decide their own fate. And this was recognized internationally by the UN, but nearly 75 years later, Kashmiris are still fighting for their right to self-determination. And in those 75 years, Kashmiris, and especially women, have faced the brunt of what is a brutal military occupation in both sides of the border. The human rights violations that have happened over the last 75 years and continue to happen to this day, there has been a lot of work done by Kashmiri activists around the world to sort of bring this to light. But it was only in 2018 when the United Nations Human Rights Council published its first report on the human rights situation in Kashmir. It was a 50-page document where they highlighted what was happening on the ground, in terms of the human rights violations that affected both men and women at that time. So if we go through these detailed reports that are published, we'll find that in order for a democracy to work, the rights of all people within it need to be respected. And if you read through those reports, you will see that Kashmiris do not live in a democracy. In fact, India, which sort of claims to be the largest democracy in the world, is not really living up to that. On the other hand, in Pakistan, which administers a part of Kashmir, there are a lot of practices that limit the right of democratic principles for Kashmiris in that region as well. Therefore, the women's ability to participate in politics in Kashmir is severely limited because the democratic process is denied in general. It's nearly impossible to call India a functioning democracy. No democracy has more than 500,000 troops deployed to civil areas in one of the most militarized regions in the world under the guise of security forces. And no real democracy has draconian laws in place like the Armed Forces Special Powers Act that allows for impunity of armed forces to commit atrocities like rape or murder with no legal recourse to action. And also it can't be a democracy where the common citizen, whether a man, a woman, can be arrested, picked up off the street, under pure suspicion and not be tried and just held in jail without their rights. There are a lot of democratic rights that are denied to Kashmiris. And one of the most pressing, which I feel so honored that we can sit here and we can talk about important issues that affect all South Asian countries, is that, Kashmiris cannot speak up. Kashmiris had one of the largest internet lockdowns that just ended recently, one of the longest lockdowns in the world. And when you're not able to dissent and speak up for your rights in a political system, you clearly are not living in a democratic system. One of the most one of the most pressing concerns over the last 75 years for women who lived in this sort of military occupation was that the military and armed forces used a lot of different methods to control and suppress the population and create fear within them. So in India, for example, sexual violence is something that is quite prevalent. And in Kashmir, it was used as almost a tool, a weapon of warfare. Women as young as 10 years old and as old as 80 years old have been victim to brutal sexual assault by the armed forces. You know, there have been instances of mass rape, like in Kunan Pushpara, where hundreds of army personnel raided a village under the pretext of a cordon search operation and abused over 100 women, and none of those people were held accountable. So this is sort of just highlighting what the backdrop of Kashmir is, given that it is a conflict zone. So it's very difficult to divorce what is happening and what has happened in terms of that military occupation when we talk about the future and what civil and political society look like. So women, no doubt, are the ones who suffer the most in a conflict zone. And one of the most distinct issues, and something that is so close to my heart in Kashmir as a result of this conflict that I've talked about, is the term of half widow. A half widow is a term that's given to Kashmiri women whose husbands have disappeared and were still missing during the ongoing conflict in Kashmir. These women are called half widows because they have no idea where their husbands are, whether they're dead or alive. And thousands of these husbands obviously have disappeared within the conflict. And these half widows, a lot of attention has not been paid to them by governments or organizations. There's no legal framework or protection mechanism that protects them. The government has sort of ignored this subset of society, and it's one of the most marginalized groups in Kashmir. And part of the reason is that when your husband goes missing, you have no idea whether they're dead or alive. You don't have a death certificate, for example. And without a death certificate, you are unable to access your bank account. You're unable to transfer property rights. So you are really severely limited to continue as a functioning member of society because you have no legal claim to the property or financial security that you were offered before. So, so there definitely needs to be a lot of attention paid to these half widows, and there needs to be sort of recourse done at both a local and global level to help the legal status of these women change. The role of women in Kashmir, like in all parts of the world, is to be engaged in civic society and part of the economic and social development of the state. Women in the West, we have the right and freedom to participate, whether it's in government, state-sponsored organization, NGOs. I mean, it's incredible to see a group of women coming here and talking about issues that really affect women, whether they're in the West or the East. We have the ability to speak freely, but women in Kashmir do not really have these rights. And it's not so much because there are social restrictions on women's participations. You know, whether women in Kashmir are very vocal, they're very well respected. Their engagement is not indicative of their lack of political literacy, interest, or capacity, but a result of the political environment that exists in Kashmir. Sorry, I just saw a question pop through, and that's it was the question that was asked was, do women after 7 years sort of have that right to announce whether their husband has passed and sort of receive the death certificate? And it's true, in Islamic law, that is sort of the guideline, but 7 years is a very long time. I mean, there needs to be even frameworks in place that allow women to get those rights earlier. You know, 7 years supporting your family and then mourning the loss of your husband is a very miserable place to be. So we need to provide mechanisms to support that. As I was saying, Kashmiri's women's engagement in the political sphere is not because they don't want to be active or that they are restricted by their families or they're not allowed to speak up because of society. It's really because of the political environment in Kashmir. So it's very hard to talk about Kashmiri women's role in politics without really understanding what the occupation has done to that. There is no political space for diverse opinion or dissent because of the occupation. So in order to really elevate the role of Kashmiri women, allow them to flourish and be active agents for change, we have to really focus on fulfilling the basic rights of Kashmiris, which is the right to self-determination. The right to self-determination is actually the first Part 1, Article 1 of the Charter of the United Nations Covenant of Civil and Political Rights. All people have the right of self-determination. By virtue of that right, they freely determine their political status and freely pursue their economic, social, and cultural development. So as I was saying, it is incredibly important as we look forward, and I hope to participate more in programs done by South Asia Democracy Watch to share more about the women in Kashmir and what's happening. But for this initial intervention, I really wanted to share the current political situation in Kashmir that exists just as the foundation, and start working with different organizations to understand how we can keep building awareness to that and also create a robust civil society. I'd like to leave it there for now. Thank you.
Thank you so much, Hola. Thank you. It was an in-depth conversation, and we are looking forward to engage more with you to learn about the situation and what can be done. Thank you for the talk. So our next speaker has an amazing profile, and that is Ms. Bharti Silaval-Giri. So Bharti has over 30 years of experience in mainstreaming gender equality and social inclusion and sectoral programs such as gender and governance, poverty, education, economic empowerment, and enterprise development, migration, anti-trafficking, climate change, ending gender-based violence. So currently she is Senior National Consultant, Nepal, providing technical support to the United Nations Women Country Empowerment. Where I kind of lost it. So women, yeah. So Women Country Empowerment. This is one of the books she has written in simple Nepali language, and the reason is so the mainstream. The mainstream or the masses could understand, and it has been widely used in Nepal for capacity building of ward women representatives in local governance, and has undergone second edition of printing. So I would like to request Bharti to come forward. And Bharti, if I have made any mistakes in your introduction, I apologize.
Not at all. Thank you very much for that introduction. Namaste to everyone. Good morning, good afternoon, good evening, wherever you are. At the outset, I would like to thank South Asia Democracy Watch for inviting me to deliberate on this extremely important topic, state of the girls' education in Nepal. Let me give you some facts first. According to the Nepal Human Development Report 2020, Nepal is still behind most other South Asian countries. It is just ahead of the war-torn Afghanistan and Pakistan in South Asia, but its Human Development Index score is below the regional average of 0.634. It stands at 0.579. Now, Nepal is a least developed country, ranking 142 out of 187 countries on the HDI. And the female HDI is very low compared to the males. The average score for mean years of education for adults in South Asia is 6.4. Nepal lags at 4.9 years. Now, the correlation between poverty and gender inequality is also evidenced through the multi-dimensional poverty index, which differs significantly by gender and social groups, rural and urban areas, ecological belts, and the 7 provinces in Nepal. This is evidenced through the slowest progress in poverty reduction, deprivation in years of schooling, child mortality, and low nutritional status. The 2011 census, and in 2021, we were supposed to have another census, but owing to the COVID-19, this has been stalled. But according to the 2011 census, 65.94% of the population of 5 years and above is illiterate. Now, you can well imagine that female literacy is much low compared to that of male literacy. Female literacy is 57.4%, whereas male literacy is 75.1%. And among the social groups, Brahmins, Kshatris, which are the upper castes, have the highest literacy rate, while Muslims have the lowest. The literacy rate for Adivasis and Janajatis is just above the national average. This is followed by the Madhesis and the Dalits. Now, all educational attainment figures also vary systematically across ecological and development regions and social groups in Nepal. Nevertheless, women trail behind men in all social groups and regions, reflecting the gender and social hierarchy and bias, leading to unequal status of women in dominant as well as subordinate social groupings. Discrimination and inequality then continue to dominate the discourse of gender equality and advancement of women, for they are universal, formidable barriers for the realization of girls' and human rights in Nepal and women's human rights. Well, we now know that this unjust and unequal condition and position of girls and women is not preordained and thus natural, but that it is nurtured and perpetuated by discriminatory traditional and customary beliefs and practices emanating from the social system of patriarchy. This is what disadvantages girls in the first place from developing their potentials, and one that has a lifelong impact on their capabilities to negotiate a better life for themselves and as women, that of their families, Although it is generally acknowledged that education is critical to expanding human capabilities that are central in securing decent work, financial and social capitals to secure a healthy life, well-being and shared prosperity. And SDG 4 calls for achieving inclusive and equitable quality education and promoting lifelong learning opportunities for all, as goals in their own right and as crucial for meeting the other SDGs. Towards this end, the government of Nepal has made numerous commitments to gender equality and education within the education sector. It has a very good policy, the Nepal Education Policy of 2019, which commits to being gender friendly and disabled friendly. It also encourages, for example, economic opportunities for women, youths, Janajatis, and the backward communities in order to be able to secure their livelihoods. It also places emphasis on the recruitment of women as teachers or principals so that they are able to empower themselves. The policy also has provisions for scholarships to poor and disadvantaged girls as well as Dalits. And the national curriculum framework has been designed with the aim of localization, decentralization, inclusion, and globalization. Now, all of these are lofty ambitions. And also the current 15th National Development Plan emphasizes that school dropout for any reason will come to an end. The operative word here is any reason. And this is what I would like to discuss. Any reason. which will be the focus of my deliberation today, to highlight the state of girls' education in Nepal. So as you have noted by now, every successive government has placed its priority on education, as it realizes that skilled human resources are the backbone of the economy. In fact, for this fiscal year, the government has added 8 billion rupees more for the education sector. No doubt, gender parity has been achieved at the primary and secondary levels, but this does not lead to learning outcomes on gender parity. So, considering that education is a fundamental right guaranteed by the Constitution, today 770,000 children aged between 5 and 12 years are still out of school. At the lower secondary level, 5.7% of children are out of school, of whom 44.3% are expected never to enter school. And girls are especially likely to be out of school at secondary school age. And these girls are much more likely than boys never to enter school. So rather than looking at how many girls are in school, a reality check on why girls are not in school needs to be done, because the issue of girls' education goes beyond just education, as there are structural and cultural constraints, and operating within the values and social norms as dictated by the social system of patriarchy that are upheld by religion, girls are systematically disadvantaged as structural inequalities and the low status of women affect their rights to education. And precisely so, as you know, the girl child is regarded as a transient member of the family who needs to be prepared for a future role as an obedient wife, a good mother, and an efficient housekeeper, while the boy child is looked upon as the mainstay of the family, especially during old age. So son preference means that the girl child must struggle twice as hard to survive to fulfill her potential. Now, if the girl child does manage to overcome health issues and gets a basic education, it is unlikely she will escape child marriage. And today, child marriage stands at 37% in Nepal, just after Bangladesh. Girls are consistently deterred from realizing their right to education by ideas about what is considered appropriate and useful. And since the girl child ultimately leaves her family, educating her is not considered a worthwhile investment, although it is well established that educated mothers bring up healthier families and are more likely to provide education to their daughters. Now, these gendered values translate into the denial of indivisible rights of the girl child, as well as the exploitation of her labor, mostly unpaid or underpaid, as it is subsumed into the basic culture. Recorded incidences of child labor are 11% higher for girls than boys. More and more girls are becoming substitutes for their mothers in the household, looking after their younger siblings, and spend 3 to 4 hours more on household chores than boys, while the mothers work outside of the home to support the family. Again, household chores are expected to be the primary duty of women, and this extends to girls as well. And this has been the case scenario in the frequent lockdowns imposed to contain and control the spread of COVID-19. As all the family members are staying at home, women's unpaid household work burden has increased, with girls lending a helping hand to fulfill the household chores. Then there is the issue of harmful traditional practices. And although there are strong legislations against harmful traditional practices and discrimination, lack of enforcement and monitoring for behavior change promotes discriminatory practices against girls and women. And these harmful practices then act as barriers to education for girls and marginalized children. And school dropout is also linked to child marriage. In the present COVID-19 pandemic crisis, the gender-specific negative coping mechanisms have included child marriage. Fewer girls are expected to return to schools, and the primary push factors have been food insecurity, closure of schools, and migration for work. So due to increases in early marriage, the risk of girls becoming pregnant at a young age face significant higher risk of complications than would occur for women becoming pregnant after the age of 20. The risk is further complicated owing to limited information and education on sexual reproductive health rights, higher vulnerability to domestic violence, including during pregnancy, and limited access to services. Moreover, poverty has created the phenomenon of child domestics, most of them girls, who are sent to work in urban households by their parents at the age of 6 or 7. And the lack of sex disaggregated data and information on children who are the most excluded from education is making it even more difficult to reach them. The commitment to gender equality in education then is not mirrored at the household level, as many households still prioritize investment in boys' education and impose a larger domestic labor burden on girls. There is growing concern that the COVID-19 pandemic has pushed back many of the gains made in the earlier years, particularly on gender equality and women's empowerment. Finally, I'm happy to note that the theme of this session is nothing about us without us. This is the feminist principle, which is essentially about shifting unequal power relations that suppress and oppress girls and women into subjugation to maintain the status quo. This principle then is about communication through first-person quotes and stories by girls and women themselves, rather than us to tell the story on their behalf. So we must listen to the girls and women so that laws, policies, plans, and programs, including budgets, are informed by their lived realities to change the unjust social norms that act as barriers to their dignity and empowerment. Thank you.
Thank you so much. What a wonderful presentation in terms of explaining us the situation in Nepal. Thank you so much. So thank you for all our, participants in attendance, being so patient. And I was just appreciating the fact that whoever has joined the conference, only few have left. And I know Jaspreet has a situation, because she's soon to be a mom. And we were just wondering, we were just so prepared just in case if she goes to the hospital this morning or last night. So we had a presentation ready by her already for all of you. So our next speaker is Sabra Bano. And I just sent a text to Sabra stating that it's her turn next. So Sabra Bano is Director of Gender Concerns International and Head of Mission for several international election observations in a renowned international gender lobbyist. And in 2019, Ms. Bano received the award of International Gender Champion. Her work has been contributing to shaping the agenda of Beijing 25+ and UNSCR on the issue of global gender electoral disparity in Eurasia for over 20 years. Recently, she was proclaimed the 4th Inspirational Woman by Think Tank Hub Geneva, an initiative undertaken by the Swiss Federal Department of Foreign Affairs. Since the foundation of Gender Concern International in 2004, Ms. Bano has been involved in highlighting the strength, resilience, and status of women in Central and South Asia. MENA, MENA region in collaboration with the United Nations, European Union, and parliaments. Ms. Bano has designed and internationally implemented the Gender Election Observation Mission, GEOM, in countries including Pakistan, Tunisia, Morocco, and the Netherlands. So ladies and gentlemen, for all of you, we have Sabra Bano. Has she logged out by any chance? Is Miss Sabra in attendance? Because I just saw her logged in. There she is. As much as we rely on technology, we always have these hiccups, but I am glad that Miss Sabra is back with us. Sabra, can you hear us? Hey, Sabra.
Hello. Hi, sorry, I just sort of, fell out of internet. Very, very strange. So my apologies.
Not at all. We just realized because you were there, then you didn't.
Right.
Ready for you. We just gave your introduction to the audience. We're right now live streaming through our website and the Facebook, one of the very integral social media, channel. And we're ready for you. Your presentation is also ready.
All right.
Before Sabra starts, I would like to introduce her in my personal capacity, if I may.
Absolutely.
I was at Karachi University, and Sabra Bano was a lightning rod leader, and her struggle against dictatorship of General Ziaul Haq was incredible. I mean, she is a great leader, activist. I mean, she had spent her whole life in activism, right from probably from childhood or something. But we always looked up to her for guidance and leadership, and not just women, but all the boys and men. We had Sabra was really mentor of a number of activists as well. And I'm talking about 35, 40 years ago when we were together at Karachi University. Over to you, Sabra.
Thank you, Fayaz. What an honor. Something, that we shared jointly. It was a common struggle, and I'm very happy that you still have some praise for the struggle of women. And that is perhaps the reason that even though I have worked for women's movement throughout my life, I have never called it women's movement. For me, it is gender politics. It is about men and women. Women's rights are our joint responsibility. And this comes from, I think, the experience that we had at also Karachi University, where women were put on high pedestal if they were a participant to political struggle. So thank you very much. About the presentation, I would just say it is a great honor for me to be invited with this great forum, because also in my professional engagement. I'm working with many international entities, but also when it comes to election and election management issues, I think United States plays a great role, not only through its intervention to regimes, political parties, political governments, but also its civil society amazingly dominates the same space within the civil society. For example, my colleagues at NDI or at IFES, they're everywhere in the world, guiding the civil society and organizing them for citizen observation. So it is really important that you watch the democracy throughout the world, and especially in South Asia. While it was also interesting for whole world, just to watch US forces bounce back. So that was wonderful experience for the world, for anybody who is interested in electoral politics. For today's, thank you very much for this topic. I just think that because of my respect for the forum and the way that you watch and the way that you have assembled such a beautiful and excellent group of experts and brought your network in, I just thought to make this presentation from our advantage point a sort of, having a set aim for SDW. So you would see that, do I need to share screen, I suppose, right?
We already have a screen share for you. That's what we can see. I think you have a technical expert helping you in this. Can you all hear me?
Yeah, Sabra, I think Sabra is having some internet issue, it looks like.
Yes, Sabra needs to unmute herself. Yes, Sabra.
Sorry, I'm so sorry about this.
That's okay. So the plan, Sabra, you see.
I mean, I will make it very short, and if it happens again, please move on to other speakers, and maybe if I have luck, I'll come back later on. Is it a good solution?
I
no,
think
it's
so.
Not.
Well, let's,
sorry.
yeah. Sabra, I have your presentation up already. Since you sent me the presentation, I already have that. I can, you tell me when to turn page.
I thought, right. So I think the important thing is that we thought it should be important to set some aims for this presentation. And so we wanted to share innovative instrumentality of GEOM. And GEOM is Gender Election Observation Mission that Gender Concerns has introduced, and gladly also in South Asia. Am I lost again?
You're fine, Sabra.
All right.
Yeah.
So GEOM is a tool to influence gender parity and parity policy formulation. The objective of, from our perspective, this presentation at SDW is to seek advice and support in further operationalization of these missions internationally, considering the role that the United States plays to gear the strength of civil society throughout the world. To start with, my team was able to put up this chart. You see that deep blue high rises of tables, and then you see very shocking pink participation of women in governance in US, and then you see also European situation. The South Asian situation is not to highlight that women's electoral participation or participation in governance is very low, but it also demonstrates that the quota system and open competition is not very common in South Asia, and that is something that is also concerning. About quota system, that actually are only, we think, I mean, quota systems exist in Afghanistan, Pakistan, UN has compelled many electoral management bodies and governments throughout the world to at least try to have 30% women there. So quota systems are temporary measures to achieve parity, inclusiveness, and they ensure minimal level of female representation in politics. And they do not extend beyond that, and in a way confirms the threshold to 30%. So in a way, we need to watch and change the situation, the perception that quota system is good. Quotas can thus only be part of the solution to achieve electoral parity. Mandatory gender quotas exist, for example, in Pakistan, Bangladesh, Afghanistan, and Nepal. Voluntary gender quotas by political parties can be found in Thailand and Malaysia. And Myanmar has no gender quota. So this is the situation. What are the hindrances to electoral parity? I think we're all aware of it, this patriarchal attitude and cultural norms, such as notion that women are not interested. Forget about that they are not capable, but also women who are very active, they are thought that they are not interested in political activities. Women are not interested to hold political position, and they are subjected to much higher scrutiny than their male counterparts as candidates, but also if they become parliamentarian and assume elected positions. Women are expected to possess higher credentials than men to achieve a political career, and their political mistakes are often connected to their gender rather than their personal characteristics. Another important aspect, and as a matter of fact, the idea that I came up with observing election from gender perspective was my almost teenage experience in Pakistan, where I was a campaigner for a candidate, and a female candidate. And then somehow we ran a very good campaign, but on election day, I saw the violence committed by women to women. And that has really deterred my political activism into electoral politics for a while, until I became that strong that I was able to set up a sort of mechanism while working with EU and other international election observation missions to go for a sort of, a solution where women observe elections and women missions are led by women, and also most importantly, they're reported by women. I would just say that because it's a watch, South Asia Democracy Watch, and we are an action-oriented organization, we believe in practical solutions. So we would also like to suggest that as you are based in the United States, it is very important that that watch becomes an instrument to strengthen democracy and democratic forces in South Asia. I think forums like South Asia Democracy Watch should be active to support civil society organizations, and especially women organizations. And they also have to support other networks that will believe in parity, but not perhaps in quota system or status quo. And we would like to say that it is important from watch to act. What is GEOM? GEOM was first launched actually, and I'm very proud about it, that was in Pakistan in 2008 elections. We had some European parliamentarians with me and women's group, and then we also actually research about all other election observation reports by NDI, by EU and other Carter Center. We work a lot with them. That there was hardly any of these election missions head by men at that time. Sometimes women had second position in EU missions. We started to raise voice, and it has changed now. Not only that, if you see prior to 2008, any report of any election observation anywhere in the world, you will see maybe one page or very minimal description of women's position at their electoral participation. So somehow, when we started that women have to watch themselves and guard themselves electoral participation, and we have to report it by ourselves. That is very important, the way we want. And not only that, when the reports are published through women's organizations, local women's organizations, we are going to lobby to the newly elected parliament, and we build capacity of female parliamentarians. This is the program we have done in Morocco, we have done in Myanmar, we have done successfully in Afghanistan. We have also worked with Aurat Foundation and others in Pakistan in 2008, but also 2013 elections with that perspective, post-election parliamentary networking and lobbying. For us, inclusive, I mean, the title that nothing about us without us, but it's not also about inclusivity. I think we have crossed that boundary of inclusivity. It is time for parity. When I started my work in Afghanistan in 2006, 2007, and then MENA region, we were also talking about inclusivity. And in the process, we realized that we are already included. I mean, inclusion is not a problem. How inclusive it is, it's an issue. And it's not about 30%, 20%. It should be about creating conditions that allow fair participation. And fair participation, to my understanding, comes when you have candidates list and there is then one-to-one selection on the list, male, female. We have done that in 2014 through Election Commission in Tunisia, and very strong women organizations fought for this, to have the listing, the selection. There also civil society and political workers not only can change the local environment, they have mechanisms to influence others, especially if it's coming from United States. Here you see the picture of recent elections. These are 7, 8, 9 women from different political parties. They are political head of Dutch election that we observed in March. And this was first time that so many women were able to be head of a political party out of 27. So it is changing, but yet they also include very small political parties like Party for Animals or Party for Minorities, where there's only one candidate. I just wanted to, and my team has done this little glimpse of the work that we have throughout the world, just to show that to achieve electoral parity, you need constant lobby, and you need media with you, you need political parties, and you also need parliamentarians. It is a joint effort, and it's a long struggle. And when it comes to South Asia, as a matter of fact, we have great example of South Asian women leading their country, but we all know about it, the way they were selected, not on their own, perhaps married directly, but with a reference, and then they assume power because of their husbands or fathers. So even this myth of South Asian top leadership has to be looked into through right lens. This is what I would like to sort of conclude with. We think the important thing is to have governance in parity in governance. It is important to, first of all, set a just system of electability. And electability comes with what you give to your candidates. And I think this is a struggle that we have a lot of problem with. Also in Europe, and when it comes to South Asia and other countries, MENA region, it's the biggest struggle. It's a long way to go. So we need forums like this. We need people like we have today to guide us, to refresh the system and look at not only the slogan of nothing about us without us, but also that how do we achieve that? How is our system? I mean, we were shocked to observe Dutch elections in 2017, where 100 years ago, election commission had no woman. And in 2017, there were only 2 women at the election commission. And unfortunately, now is also in 2021 situation was the same. So when it comes to election management bodies, the doorway to electability is not questioned. There's a lot of attention pumped into women's political participation, inclusivity, without really realizing the mechanisms for that inclusion, meaningful inclusion. And this is my plea to this forum, to other participants, to please guide and advise us. If you think it's a valuable analysis, we are launching GEOM. We invited by Morocco and now Libya to observe next elections from gender perspective. I would be grateful if you have any suggestions and comments to take this GEOM formula further. We have our details. Please, if this forum doesn't allow, feel free to contact us. Look forward to working with SDW and others. Thank you so much.
Thank you so much, Sabra Bano. And indeed, the meaningful inclusion of women matters. So thank you so much for sharing your thoughts, your presentation, and taking the time out. We are delighted to have you. I'm just going to remind all our attendees that we would be having another speaker, and after that, we will be opening the full floor for question and answers. We would request, if you have any questions, you can always write in the chat. That would be I think convenient and would be uninterruptedly answered. And we would request all the speakers to stay till the end, because we're doing very good on time, and a couple of our presenters unfortunately could not join, and that can be, we should be able to know the reason soon. And then the conference will be concluded with the word of thanks and remarks by Syed Fayaz Hassan. So our next...
One quick thing, Sabra, if you can close your
screen share
sharing. Yeah, I think.
All right.
Somehow.
Sorry.
Yeah, no problem.
Is it done?
No.
Oops. Okay.
No, you unshare your screen.
Yeah, that's what I did.
Okay, here you go.
It's gone?
There you go.
Yeah.
It worked.
Thank
Great.
you so
Thank you very much.
Thank you so much.
Oh, Nadine, you're there.
So our next speaker is a wonderful activist. I have heard a lot about her since I have joined STW. Since I get to know Aftab and Fayaz, I've heard about her work, about her aspiration, and how resilient she is. So that is Beverly Hills. Welcome. Beverly Hills is founder and president of the Gendercide Awareness Project. She graduated from Duke University summa cum laude and returned for graduate work in history, winning a Fulbright scholarship to study in France. She later lectured at the University of Massachusetts and University of Iowa. Beverly Hills founded the Gendercide Awareness Project in 2011. Its purpose is to combat the little-known atrocity of female genocide, commonly called gendercide. The organization it has two major goals. That is to raise awareness about gendercide, to fight gendercide by educating vulnerable girls in low-income countries. And to date, the Gendercide Awareness Project has educated almost 3.7 million people who about gendercide. It also has funded 155 girl years of education. That is fabulous. So Gendercide Awareness Project began its work in 2011. Only a handful of tiny organizations existed to combat gendercide. Most of them focused on a single country. Unbelievably, this is still the case today. Yes, it is. And tiny as it is, the Gendercide Awareness Project is the world's second leading umbrella organization, exceeding only by the United Nations Population Fund. So ladies and gentlemen, we've got Beverly Hills for you. Welcome.
Thank you so much, Ambreen. Thank you, Dr. Abbas and Syed Fayaz and Aftab and all of you at South Asia Democracy Watch. I am honored to speak and humbled to be on the roster with the list of speakers we've had today. It's incredible. I'm going to share my screen now. Can you see it? Very good. Gendercide, I think most of you know, is female genocide. It refers to the worldwide elimination of females from very young to very old due to social causes. And I underline that phrase, social causes. This is a man-made problem. Now, whenever we're speaking of gendercide, we're always talking about excess female deaths in excess of male deaths for men and women of the same age bracket living in the same country. So what's happening? What's going on? How are we losing so many women? There are 4 major causes. I think some of these are familiar to you and some will be a surprise. The first one is selective abortion of female fetuses in countries where there's a strong preference for sons over daughters. That has been in the news quite a bit. I don't think anybody is surprised to see that there. Next, moving chronologically through the lifespan of a woman, we lose a lot of girls in the very early years, in infancy and early girlhood. Again, in the countries where there is a strong preference for sons over daughters. These girls weren't wanted in the first place, so they're neglected to death. And we find high rates of that in countries where abortion is illegal. Abortion is usually the preferred way of getting rid of unwanted girls. Third, we have maternal death, and we've heard a lot about that today. It is 99% preventable at very low cost, and there is no reason for us to be still losing 300,000 women every year because of maternal death. If countries can build nuclear weapons, as Aftab pointed out, and they spend billions on their militaries, they can spend a sliver of that to prevent maternal death. Lastly, and this is the one that may surprise you, we lose enormous numbers of older women, especially widows, after age 50, for the simple reason that they cannot access food, shelter, and healthcare as easily as men of that same age in the same country. So those are the four major causes. Let's look quickly at the relative importance of each of them. On the left, you see the percentage that each of those causes contributes to the annual loss of the annual excess female deaths. It doesn't add up to 100. I don't have time to go into that. But sex-selective abortion is the largest cause. But the second largest cause is this perishing of older women. And this is something that is never in the news. I have never seen an article in the mainstream media about this. And then we have the other two causes. And here on the right, you see the relative, the absolute numbers of deaths per year attributable to those causes. So how many women are we losing? There. We're losing 3.2 million women per year. These are excess female deaths as calculated by the United Nations Population Fund. Okay, so if we're losing 3.2 million per year, what is the cumulative loss? Well, again, according to the United Nations I'm sorry. I forgot to mention that is 6 women per minute that we're losing. 3.2 million per year is 6 women per minute. And the cumulative loss is 143 million women. That is obviously a huge number. It doesn't make sense in isolation, so we'll put it in context. 143 million is 43% of the United States population. Another way to understand this is to compare gendercide with other atrocities. Here you see that gendercide has cost more lives than World War I and World War II combined, more lives than the genocide of indigenous peoples on the American continents. In fact, it is the largest atrocity the world has known, and yet almost no one even knows about it. The last way to understand that number is to express it as a percentage of the world's female population. 143 million is 3.7% of the world's female population. That's almost 4%. So I want to let that sink in. That is a staggering loss of life. Almost 4% of the world's female population eliminated because of social causes. And it shows us that oppression of women doesn't simply make their lives difficult, it's lethal. And it's so lethal that it makes a measurable dent in the human population. And if you remember nothing else from what I say today, I ask that you remember that. This underscores the need to move to gender equality as quickly as possible. This quite literally is killing us. So let's move on and look at gendercide in South Asia. Again, here are the 4 major causes. I've grayed out the last one because it's no longer in play the way it was historically. But the 3 first ones are very much in play. We'll start with sex-selective abortion. Now, the way that you measure sex-selective abortion is by looking at the sex ratio at birth. You count the number of male births and you divide it by the number of female births, say in the last year, and that gives you a ratio, which is usually expressed as the number of male births per 100 female births. I'm going to skip those. Okay. So here we have it. The red line represents a normal sex ratio at birth, which is somewhere between 105 and 106 male births per 100 female births. Nature doesn't give us equal numbers, and she has very good reasons for doing that. Ask me later if you'd like to know. Azerbaijan has now leapfrogged China as the country with the highest, most distorted sex ratio at birth. The two countries highlighted in yellow are South Asian countries, India and Nepal. So as you can see, this is definitely a problem in South Asia. In addition, we have the problem of girls being neglected to death. Demographers would classify that as excess female child mortality. We see it a lot in countries where abortion is illegal. And so here you have a map of that. In India, it is well over 13%. Again, this is not total female child mortality. It's female child mortality in excess of males, 13% more girls than boys neglected to death. Afghanistan comes behind with more than 5, then Pakistan at 4.7, and so on. The last major cause for the loss of women in South Asia is maternal mortality, as we've discussed. Here is a heat map. You can see that globally, the problem is most acute in Africa. South Asia is in second place. So we find that the combination of these three causes creates a real sex imbalance in certain countries. India, for example, has lost 9.3% of its female population. That's exceeded only by China, which has lost 10.3%. Sex imbalance has all kinds of consequences. Most of them, all of them, are unsavory and ugly, something that no society would want. And I'm going to run through them really rapidly. Sex trafficking, there are not enough women to go around, so sex trafficking develops. Bride trafficking also. These brides are purchased and sold and resold like slaves. Effectively, they are slaves. An increase in child marriage because there are not enough women to go around, so bachelors marry girls. Child brides quickly become child mothers, and that causes an increase in maternal death. These women are too young to be having children. Very young child mothers are 5 times more likely to die in childbirth and its consequences. This also affects men. All the consequences I've listed so far affect women adversely, but men too are affected. There are always men who will not find life partners, who suffer what you see in that list. China has studied this and even found a markedly shorter life expectancy for lifelong bachelors. Lastly, an increase in crime develops. It's well documented. Ask me about it in the Q&A if you'd like to know more. So do we want this? Of course we don't. This is just a laundry list of ugly social practices. We all want to get rid of it. But it drives home the point that a normal, healthy sex ratio stabilizes a society and makes it a more desirable place to live. So how do we get there? How do we get these sex ratios back to normal? One of the most effective things that we can do, probably the most effective, is to educate girls, especially poor, vulnerable girls. The benefits of educating girls are well established. I'll let you read that list. And this is what our organization does on a small, very modest level. We educate girls in 6 middle low income countries. So to summarize, in the time I've been speaking, we lost about 100 women and girls. Again, this is excess female mortality. It drives home the point that we need gender equality now. This is intolerable. A good first step to get there is to educate girls. And here is my ask. You all could be so helpful and so useful in partnering with us. We are very pleased by our previous partnership with South Asia Democracy Watch. We want to see that continue, but obviously we're tiny, we can't do this. We need all the help we can get. We need advice, we need ideas. Let's tackle this together and get those sex ratios back to normal. Thank you.
Thank you so much, Beverly. Absolutely. These are some eye-opening numbers. And on top of that, since we are representing the women from South Asia, and this is one of the major issues in our region as well. So our heart is open for you, and we make sure that we should be able to do another collaboration with you in near future. Like I said, since I joined STW, I have been listening about your work, you know, of course, a lot of appreciation about it. And we would encourage rest of our listeners, our participants as well to engage. Because if we're just going to talk about issues this morning and then later we dissipate and maybe show up in another conference, it would be great for our personal enlightenment. But how about the social, the responsibility we all have? So let's focus on that as well. So ladies and gentlemen, Beverly was our last speaker, whereas we plan to have another wonderful speaker, two wonderful speakers, one from Pakistan and one from Afghanistan. So since this is a conference that heavily depend on internet and the availability of internet, so I would love to share the profile, because we do not know the reason that why they couldn't join us. We would love to share their profile with you. So one of our speakers this morning was Dr. Nafisa Hamra, and she's from Afghanistan. And Nafisa basically is a gynae surgeon working in Malalai Women Hospital, Kabul, which is the biggest hospital for women in Afghanistan. She is an excellent fistula surgeon and organizes fistula repair camps in different parts of Afghanistan. Our moderator for the first session himself has been running a massive operation, I would like to call, for helping these girls who have been suffering from fistula from different communities in the South Asian region. With that, the last speaker who was supposed to be this morning is Mehnaz Rahman. So Mehnaz Rahman has been working as a resident director at Aurat Foundation's regional office based at Karachi since 2010. She's known practitioner on women's rights and socio-political issues, and has worked with diverse institutions ranging from media, Aga Khan University, Church World Service, and so on. So Ms. Mehnaz was elected the first female president of the Employees Union of a newspaper, and also has the honor of being awarded the Friendship Medal by the Prime Minister of People's Republic of China, Li Peng, in 1991, for promoting friendship of two countries through her writings. She got Lifetime Achievement Award in 2020 by Sindh Commission on Status of Women. Most of us from India, Pakistan, Nepal, Bangladesh, or from the South Asian countries, we know about Aurat Foundation and their contribution. Unfortunately, Mehnaz couldn't join us today, but I suppose she's here. Both our speakers are here in the spirit. Now, next is our question and answer panel. And I would love to give a heads up to all our speakers, and you know, you can actually write the questions to us. We have a few questions already lined up, and I would appreciate if Aftab Saab and Fayaz Saab can join us, helping in moderating these questions, and Dr. Shersha as well.
Thank you, Ambreen. And
Thank you, Ambreen.
wow, this is great conference. We have seen so much and so diverse subjects. Yes. Hello. Yes, so if you have something, a question, you can put this in chat room or unmute yourself, speak clearly, and when you're done, please mute yourself. And no counter questioning. I think we'll have more productive conversation if we just let the speaker talk about those issues. So,
I do have the first question for Dr. Swaraj, if I may.
Please.
Dr. Swaraj, thank you for your comprehensive and very good presentation. I know that you have worked in a number of countries. So can you really give us a sense of the South Asian countries, comparatively how these countries are doing regarding the maternal health and childbirth? Just a short answer so that we know that where these countries really fall on the in our comparison.
Thank you, Aftab. That's a very difficult question, but I'll try to sort of share what I have seen in the field and what I have gone through. Sometimes the statistics does not depict the actual scenario, and especially the urban and the rural areas differ a lot in every country. To me, like having worked in India, especially Uttar Pradesh and Karnataka, I see that I think there needs to be, although the statistics shows that their institutional delivery has increased a lot, but the quality of care is very, very poor. I think I can only say that. And other is the respectful maternity care is what I miss in our part of the world. Okay? And in Pakistan, Shersha would be the best person to say. But even in Pakistan, I see like there is a vast disparity because of the geographical terrain. Many mothers suffer a lot during the home delivery and they do not have access to the healthcare services, even in Pakistan, especially due to the Parda system and not being able to be seen by a man and so on and so forth. And same is the situation in Afghanistan. I have worked in a couple of hospitals in Afghanistan, and especially I will share one incident when we had to conduct an emergency cesarean section on a woman who had fetal distress, but we could not do that because there was no man accompanied her. So without male from the family signing the consent, you cannot operate. And that is not the scene in Nepal. In Nepal, the woman herself can give the consent. In most of the places, even the female accompanying person can give the consent, whereas we had to wait till the man arrived in that hospital. And by the time the cesarean section was performed, we lost the baby. So I see that a lot of discrepancies and the empowerment is an issue. I see Bangladesh, I have worked, but I think Bangladesh has done pretty well in both maternal and the neonatal health. And in Nepal, although like the education is an issue, The primary education is free now. It is like the enrollment has increased, like Bharti had already mentioned. The primary enrollment is 96%, and secondary, the fallout is from the secondary level. But if I compare with all these countries, although like we are in the, in human index, human development index, and the poverty level is, if you compare, Nepal is not in that high level. But if we talk about the maternal and neonatal health, since I've seen all these different regions, I feel that we have done a pretty good job in improving the maternal and neonatal health. At least we have the delivery set when we conduct delivery, even in the birthing center. The logistics are available now. I'm not talking about the 20 years ago. But if I go to a very rural setting in India, the women have to deliver without a set. One delivery set we're using for a couple of women delivering in the labor room. So the scenario is very, very tragic, I would say. And I told myself that because one breech was delivering, so I had to use the same instrument. And I told all my students that I have done a crime today, but I had to save this baby. What to do? I had to use ordinary gloves. I had to use the same instrument, just not sterilized, just washed, and I had to use because there was no time. So these are the scenario, I would say, and we have to go a long way. And like I said earlier, also there has been a lot of political instability in Nepal. We had 10 years of People's War, but during that time also the public health system was not disrupted. Even those people allowed the health worker to go to the villages, take the medicine, although they also wanted some medicine from that stuff. But during that time also our indicator didn't drop down. And with this pandemic, COVID pandemic has really hampered on the maternal and neonatal health. And I know the Nepal's situation, we really have to work hard to achieve the SDG goal of 70 and reducing the NMR. But overall, I think if I compare, I think we are doing much better. Thank you, Akhtar.
I have a question,
Please go ahead.
Sabra. So when Sabra, you spoke about the fair participation, and you have been heavily involved in projecting that how important it is to have a democratic way, and where, it cannot be without women or the other genders. So what kind of approach does the media in Pakistan or in South Asia has? Did you face any issues related to the impartiality and transparency, and how openly they talk about it?
All right, so there are two things, we had this gender mission, and 2008, somehow with the support of Election Commission, we were able to visit all television center, media centers in the country. That was very interesting. That helped to highlight women's participation. But there is another dimension to women's participation, and also the way election mission. If you have seen EU or some big missions, how much do they spend on taking their huge team to support their own missions and their mission heads? So this is how really patriarchy works, through the missions, through the media owners. I think in Pakistan, as we know, we have great number of democratic journalists, but women activists. Fayaz would know that Karachi Press Club was and is still a sort of center of gravity for democratic forces in Pakistan, and feminist how to say the progress that has been made during these decades. Basically, I really think it is a worldwide issue to really have media attention for women's political participation, especially, there are other issues that media might find it interesting to sort of highlight for their own, news value consumption. It is something that really, I mean, we think we need to invest training journalists. We just submitted a project proposal for Afghanistan where we are proposing a second level of journalist cadre to sort of be trained with peace process, but also women's inclusion. So yes, you have highlighted a very, very sensitive issue about the media and the mindset of media. They focus on women, but the focus is not in support of democratic forces and feminist ideologies in general.
Absolutely. Thank you so much.
I would have a question when you have time to Hola, please.
Yes, Hala is around, or I think she's left.
Yeah. Hola,
But I think,
always, I read your question, Sabra. Would you like, is this the same question you would like to?
Yes.
we have Raja Saab, Raja Muzaffar, who's Senior Vice President of Jammu Kashmir Liberation Front. So if he can probably address your questions too.
Can I just do a half a minute context to that?
Yes, please. Go ahead.
Thank you very much. I mean, one of the areas that my organization and I work is women, peace and security under United Nations Security Council Resolution 1325. And in 2007-8, Dutch government, drafted its first national action plan on women, peace and security, and to support women in conflict areas. And somehow at that stage, I was able to bring women from Srinagar as a follow-up to my visit in 2005 there, that we wanted to have some women activists and connect them with European Forum. So somehow in 2007 and 8, we did some work on women. And then I was sort of like really warned from other politicians and my friends at the ministry that this is not the theme that anybody is supporting, So it is really, since then, whenever it is possible, I try to highlight the issue, but it's such a failure. I personally have been able to work in Libya, Tunisia, Myanmar, in many countries, but the great failure to my career is Kashmir. I have spoken with many Indian feminists because I really think, and that's why I was thinking Hola was encouraging us to do something about the peace and security and women's participation there. But I think the key perhaps lies to Indian feminist leadership to this issue. And perhaps they should take lead to invite Kashmiri women activists and Indian feminists, and maybe SDW should do that. We need a dialogue, consensus. We can't leave women in Kashmir like untouchable. It's not possible. It's outdated. It is not because I'm Pakistani origin, I'm saying, I mean, it's not about that. It is my personal failure that where I don't speak the language in Morocco or Libya or Afghanistan, but where I speak the language, understand culture, very much I'm a total failure. So this is a like personal pain. And I just thought Hola's presentation was very inspiring, a young woman's passion with that. And I need some guidance. I mean, we would like to do something about Kashmir, and what is the best way? Thank you. Sorry.
Well, one thing I think, just if Jaspreet is, she's a activist from India, women activist from India. Jaspreet, if you're.
So Jaspreet is also not around, but
Oh, she's not. Okay.
You have given us so much food for thought. So what we're going to do is that we're going to organize at least a talk among ourselves that each one of us, the capacity, if we have to mobilize in India and in Pakistan on the level where we are talking about peace building through women. So we have to actually, kind of dismantle the fact that, what is the impediment, or we know, of course, they're like political grounds, but, we should be able to, figure this eventually, that how women can be helpful, because women has been helpful in peace building. You've mentioned yourself, you work with them, but what is the impossibility about Kashmir issue that women cannot be mobilized there? So it's a great approach, and we should be able to reach out to the people and have a talk between us. How about that?
Well, one thing that I can see, and it's a glaring example, and Sabra, you can probably shed some light on it, is the experience of Rwanda. A country that was torn apart and with genocide, with so much killing and hatred among people. Rwanda parliament has 68% women participation in it. It used to be 18% in 2010, I believe, and then it is, I was just looking the numbers, it is 68%. And that brought peace in that one region, which was so dangerous to the whole ecology and humanity in that country is in peace. I would say that it's not a coincidence that the peace came with women leadership in parliament and stuff. Sabra, would you shed some light, because I think when women come to politics, and I've seen this in many other places also, even in US, when women come to politics and when they're representing families, they're representing children, and the whole thing. It's not about muscle power. It's about us, human. And I think women are better fit to lead. That's what my personal feeling is. Sabra, if you can shed some light on this.
Thank you. And I think Raja Muzaffar was also going to say something, working with friends from Kashmir. We also see a lot of politics about it, but that's why I think, my perspective about politics is that it doesn't matter which party wins. Women have to struggle for their rights. So that's why I think electoral politics is the solution. For anybody who is in gender and development, I would like to address the issues of inclusion and parity. Within that, we also think that you gave very good example of atrocities in Rwanda, and that has also led to where women are now. Kashmir, we can't enter. And that is the problem. Whole international community has been supporting these countries. And that is the issue. You can't interfere. We can't go to Srinagar. And so that's how somehow I have, what was it, 2019, we ran again another campaign. I even went to Indian Embassy in The Hague, and I requested them that and I've written to a lot of people, even went to UN in Switzerland. I happened to be there. So, but I was told by a lot of people that perhaps, why I'm wasting my time, really on your face, more or less. So I just don't know. I think perhaps key to some kind of intervention or having some kind of, I think feminist consensus would be the key. Perhaps there are a lot of great feminists in India. And I think we need to bring them together with Kashmiri women and then maybe ally them with little international support and see how far it goes.
Right, sir.
I just want to add something in addition to Sarah Banerjee. कश्मीर का जो आपने जिस तरह इशारा किया, सबसे पहले तो मशहूर हूँ कि आपने कश्मीर को यहाँ पे डिस्कस किया है और इस ह्यूमन राइट्स पहलू के ऊपर भी। तो बेसिकली कश्मीर एक सियासी तनाज़ा है और जितने भी राइट्स वायलेशन हो रही हैं जो उस सियासी तनाज़े की वजह से है और अगर ये हल हो जाए तो ह्यूमन राइट्स वायलेशन भी खासी कम हो जाएंगी। यहाँ तक अभी थोड़ी देर पहले, क्योंकि मैं मौजू पर रहना चाहता हूँ, ख्वातीन का वहाँ पे जिस किस्म का, तो इसकी बड़ी सफरिंग उनको लेनी पड़ रही है कश्मीर की ख्वातीन को इस कॉन्फ्लिक्ट की वजह से। आप अगर उठा के देख लें ह्यूमन राइट्स ऑर्गेनाइजेशन की रिपोर्ट, तो आप वाकयात मिलेंगे, डॉक्यूमेंटेड वाकयात, कि कैसे ख्वातीन जो है उनको यानी अस्पतालों में जाने में क्या प्रॉब्लम आया और इसी तरह विडोज का प्रॉब्लम क्या है। और ऐसी चीजें हैं कि जो जिनके ऊपर बहुत ज्यादा जिक्र नहीं आ रहा है, जितनी मर्दों की।
In fact, what Raja sir was saying,
मैं समझता हूँ कि
yeah, in fact, what Raja sir was saying is exactly very much identical to what we heard in conflicts in Bosnia, in Afghanistan, in other parts in African countries. The women were subjected to violence, like Sabra, you also had in your presentation. And we had a big, I mean, one international conference that we had at Southern Methodist University, and we brought women from those war-torn countries, and that was one thing that was common theme among all the countries, that nobody heard the stories of women, how they suffer in conflicts and violence, you know. And we always talk about men giving their lives. I mean, like if you talk about Bosnia or Kosovo, or always see the impact on men who are fighting or who are suffering, the father. We never hear about mothers. We hear about fathers, you know, even in Palestine, you know, we hear a lot of stories about how fathers are trying to put the family together, but we don't hear much of mothers. But in Kashmir, I think what Raja Sahib was talking about is the same story. You know, it's not any different. If what I'm saying makes sense to you, Raja Sahib? We cannot hear you. Yeah, your voice.
बिल्कुल मैं आपकी बात से इत्तेफाक करता हूँ। बेसिकली हम जो जितने भी इस किस्म के फोरम पे कोई गुफ्तगू करते हैं या कुछ है, इसको इस सेंस में ना लिया जाए कि हम कोई प्रोपेगेंडा वो कर रहे हैं, बल्कि रियली हमें प्रॉब्लम को आइडेंटिफाई करना है और उसके ऊपर हमें अपनी ब्रेन हैमरिंग करनी है, बीइंग एज अ ह्यूमन राइट्स एक्टिविस्ट, कि हम इसमें क्या मदद कर सकते हैं वहाँ पे हालात को बेहतर करने में। तो मेरी गुजारिश होगी साउथ एशिया डेमोक्रेसी वॉच से आप एक डायलॉग कराएं कश्मीरियों के ऊपर, इंडिया, पाकिस्तान और कश्मीरियों के दरमियान में, और जितना भी डायलॉग के जरिए से इसको लोगों को करीब ला सकें और समझ आ सके कि असल मसला क्या है और वहाँ पे इस किस्म के, तो ये बड़ा एक आपका एहसान होगा उस खित्ते के अंदर रहने वाले लोगों के ऊपर, क्योंकि सफरिंग जो है वो दिन ब दिन जा रहा कि मसला क्या है। तो मैं अगर इसमें आप कुछ हमारी मदद कर सकें यानी डायलॉग कराने में, तो बड़ी मेहरबानी होगी।
So we can have with Sabra, we can have a separate dialogue with Kashmir leadership also. You know, we are in touch. I mean, through Raja Sahib, we are in direct communication with Kashmir leadership also. So great, wonderful.
Yes, and thank you, Raja Sahib. We are running out of time. I do have a couple of questions for other speakers, please. So is Dr. Bilkis still here?
Yes, she's here.
Yeah.
And I have a question with Dr. Shesha also.
Yeah. Hello,
Dr.
can you hear
Shesha.
me?
Yes,
Yes.
Dr. Bilkis.
Yeah,
Okay,
yeah.
thank you very much for your wonderful presentation. I do have a question.
Yeah.
I've been looking at some of the statistics about Bangladesh, and they have done really well on healthcare issue in comparison to so many other countries in South Asia. What is the lesson that India and Pakistan, being two major countries, can learn about the successes of the Bangladesh government and society?
Yeah. Thank you, Dr. Aptab. Bangladesh government have some initiation to serve the low income group, and for that reason, you have seen the discrepancy between the urban area and rural area. Most of the urban area are wealthiest people, and they can go to the private sector. In the private sector, they are price is high, that is costly. So for the rural people, Bangladesh government have take the initiation, that is the more than 13,000 community clinic. They are serving the rural people around 6. In each clinic, they can serve around 6,000 rural people. They can communicate to the family member also. They are giving the health education. And another is the demand side financing scheme. That is, they are giving incentive to the clients and also to the service providers. That is establishing in 92 primary and the secondary center. Those who are doing the delivery, that is cesarean section and delivery in the facility, they are Bangladesh government is paid both the clients and the service providers. Another thing, that essential newborn care, that is cord cutting, clean cord cutting, and delayed bathing and initiation of breastfeeding within 1 hour of birth. It is the policy to spread all of the non-facilities delivery. That is 51% home delivery is occurring. So non-facility delivery should be established by the skilled care provider or by trained TVS. This is also a policy. So by this way, Bangladesh is improving regarding the childhood mortality and maternal mortality reduction.
Thank you very much. Good case, good example to follow by the Indian and the Pakistani governments and societies. Okay, I do have question for Beverly Hill. Beverly, you were talking, thank you for your a very good presentation, and it is really heart-rending basically to see that so many women are literally dying every minute, every hour, and these deaths are totally preventable. So you were talking about a few more facts and figures that you wanted to really share with us. So please go ahead and say a few words.
Certainly. I'll make a couple of points. First of all, the crime, the increase in crime, both China and India studied this slightly different ways, but with the same conclusion. In India, there was a study that looked at murder rates, and they did a multivariable linear regression considering other variables such as education, literacy, urbanization, but it was found that murder rates correlate more closely with sex ratios than any of those other variables. So the sex ratio in a state in India is the best predictor of the murder rate. China did a study in which they found that a 1% increase in the sex ratio caused a 5% increase in crime in that region. So that's one point that I'll make. The other is I wanted to show a map. I'm gonna share my screen and go back to my presentation. Let's see here. The problem of sex-selective abortion in India, or the sex ratio at birth, is just intractable in India. China has made more progress. They're still in a slightly worse position, but they were far worse before. But on the left, you see a heat map from 1990 showing sex ratios at birth. And on the right, you see one 26 years later from 2016. There has been modest improvement in Haryana and Punjab and Delhi, but there's been deterioration in some of the southeastern states. So for the last 25 years, the sex ratio in India, the sex ratio at birth in India has been around 11%. There just has not been an improvement. And I would say that the Indian government has not tackled the problem as aggressively. They have relied mostly on billboards and media campaigns and public messaging and movie theaters and things like that. China relied more on providing financial support for rural agricultural families who didn't have sons, and they needed that laborer. They were a little bit more practical in their approach. I would also show this heat map. Again, India. I'm not demonizing or vilifying India. It's just we have much better data for India than for any of the other countries. The other countries in South Asia, it's very hard to get data. This map shows where excess female child mortality is most severe. In other words, where girls are neglected to death the most. And it's also in the north, but a little bit more on the eastern side, focusing on Uttar Pradesh and Bihar, which are two rural, extremely conservative states in India. Lastly, I didn't discuss femicide as one of the major causes because numerically it's not a major cause of loss of female life compared to the others, but symbolically and socially it's tremendously important. It's estimated there are about 100,000 femicides per year. That's only 0.3% of the annual loss of female life, of excess loss of female life, but it's mostly intimate partner murder, but also dowry murders and honor killings. So I will stop there. Thank you.
Thank you very much.
Thank you, Beverly. I have a question to Dr. Shershaw. Basically, we talked about the South Asia, where the maternal mortality rate is very high, and the infant maternal mortality rate is very high. And I believe it was Jaspreet's presentation. She showed Dalit is higher than Dalit. Infant maternal mortality rate is higher. Here we have a situation in US. I mean, just here in Texas, the infant maternal mortality rate is very high, especially the maternal mortality rate is very high. There are not many standard that we are following. There are different definitions, and in different countries that is adopted. Is it from childbirth within 1 year of childbirth, or some other related mortalities that that we see? When I did my research, I found that there is not a standard definition of how you check the mortality, the maternal mortality rate. Now, the problem here in Texas is more acute within the African American community. It's a very particular case where the maternal mortality rate is especially 10 times higher than the white mothers. And I could see some parallel with the Dalit maternal mortality rate in India. But what could be the cause? I mean, this is a big problem that we had it in California also, but California kind of they address some of the issues, and it is much better. But here in Texas, the maternal mortality rate is very, very high, alarming level, especially within the African American community. Would you have some advice to us in Texas? Dr. Shesha is.
Oh, he's not here.
He's not. Okay. So, okay. Anyone?
Saeed.
Anyone from?
Saeed.
Yes.
This is Deborah.
Yes.
I'd like to also interject. Thank you for bringing that up. I was going to add that when I thank you and AFTAB for inviting me. It's not only Texas and California, but it's a national issue.
It is.
And it's not necessarily an economic issue. And
Yes.
it has been because Serena Williams, the tennis player,
Yes.
She almost died in childbirth.
Yes.
There was a Black judge on television. I can't think of her name, but her daughter-in-law, she actually died in childbirth. And it's actually a racial thing. It's because the doctors treat Black women differently, not only women, but patients, periodly. They don't listen to the issues that they have. They think that Black people don't feel pain is one of the issues. They ignore any of the complaints that they have. And that is the reason for some of the people that are not poor and have the same issues. So it's not an economic issue. It's a racial issue. It's racist that there's a higher mortality rate for women and children that are dying unnecessarily because of their lack of treatment and lack of the doctors actually listening to what's actually wrong with them.
Thank you, Deborah. Thank you for elaborating on this point, because I mean that is a question. That's what I always say. It's not a medical, maybe if there is any medical issue, but it's not a medical issue. It's not economic issue. It's a moral issue.
It's a moral issue.
That we are not. And when I heard Jaspreet's argument in India for Dalit, the untouchable portion of the society, it reminded me of this issue here in our backyard. Yeah.
Right. Yeah. It's
so
because some African Americans do not get any medical care because of economics. That is some of the reason, but it's not all of the reason.
It's not all of the reason. Yes.
Yes. And again, thank you for your invitation. This has been a wonderful conference.
Thank you, Deborah. So, any more question anybody has, or?
I did have a question for Bharati, but
Okay.
she had to leave, so that is
Oh,
okay.
okay.
That is
Mhm.
fine.
He just
Okay.
left, and now
But people can view this whole conference. It would be on our website, the sadw.org. That's for South Asia Democracy Watch. And we are on Facebook. We are on YouTube also. I'm sorry, go ahead, Amreen.
So now we would request Mr. Fayaz Hassan for his vote of thanks and concluding remarks, and we will be wrapping this up very soon.
Thank you, Amreen, and thank you all for participating. This is such a great participation, and experts from all over South Asia, and we were really hitting a common chord. It is not just in South Asia, but in our backyard also. When women are not treated, I would not even say equally. Equal is, I would say, fairly, because I consider women to be even in better shape and better mindset to lead and to resolve all the contemporary issues. I think that is, and the evidences are there. I would just give one example of Rwanda, where peace was brought basically by women, when they were represented in democracy. So it is my pleasure, it's my honor to be here and concluding this conference. I think one thing that jumps out from this whole conference, whether it's medical issue, whether it's representation, whether it's other topics that we discussed, I think the main thing is that the society must consider women to be valuable. And whether it's economic value or social value or political value, one society, when you place value on women, you would not be aborting them, as fetus, and you will not be killing them at early age, and you will not be pushing them around for a lot of, because of social ills. I mean, we started with the first comment that Dr. Shesha said, talked about, is the Pakistani Prime Minister statement that that's the bottom line, that women should dress more and more and more. And there is no compulsion, nothing on the men's side, so it's basically, it shows the mindset of men, especially in South Asia. We are in many societies, women are treated as commodities, and they are just not, I mean, they're very far from equal. And I think that women should not just be equal, but even more than men, because women provide solutions to a lot of issues. And I think the war and peace issues should be addressed by women, because men have failed in many parts of the world. So that's my conclusion of the conference. I think there are two things that came out, was the education and labor force participation. Those are two things that can help women being seen as economically viable and participating in society. So having said that, I thank you all, our leadership, our board of directors, Raja Muzaffar, Tausif Kamal, Kaisar Abbas, Aftab Siddiqui, Amreen, Raja Zahid Khanzada, Amir Makhani. This is what, 7th or 8th year that we are in operation. We have tackled a lot of issues. At least we have addressed a lot of issues. And when we do these conferences, it's not just the talk. We are creating a community also. And here from US, we are creating community of activists whom we will have a lot of interaction and linkages back and forth. We will see each other in other conferences also, or other discussions, but these conferences, these discussions make the environment that is good for our humanity as a whole. We will, if we don't resolve all the issues, at least we will be making an attempt. It reminds me of the first conference that we had on the status of minorities in South Asia. And the conference chair, Dr. Halperin of SMU, he concluded with, when responding to one question, he said, somebody asked, so what should we do to when we see so much injustice and atrocities against people, against minorities? He said one thing, and that's very I would say instructive, when he said that I'm not going to suggest what you do, but do something. And that's what I think the conclusion here is also, we all should do something, you know, to stop the injustice, to stop the violence, to stop the gender divide, gender inequality. We should do something. And I thank you, all the panelists. We had great forum with such an expert panelist, you know, and our leadership. And the biggest help that I had is my niece, Maria Azam, who helped me, who helped us with this conference, with all the technical issues. You know, she's a web designer, and she put our live transmission into Facebook, into YouTube, and on our website. So that is great communication from us. I think we had a very successful conference. Thank you all for participating.
Thank you. And I would like to thank Maria as well. She's here from Canada, and she was the tech support. So for the SDW First Women's Conference, she was the tech lead. And I would like to thank everybody who stayed back till the end. If anybody else would like to say anything, so we can wrap it up.
All right.
Thank you. Thank you very much, everybody.
Thank you very much.
So on that note, we would conclude our conference. We would like to thank everybody, each one of you, as the speakers, the participants, for having so much patience. And we would like to thank Syed Fayaz Hassan and Aftab Siddiqui for putting this together, the two prominent members. And I would like to give the whole credit of the lineup to Mr. Aftab Siddiqui, and that's a fact.
That's very kind of you, but it was always a team effort. Thank you very much.
Okay, so that we have permission from the conference chair to end this meeting?
Yes. Okay.
We'll see you all in the next
conference.
Yes, and by the way, it's available on YouTube. I'll be sending the YouTube link to all. It's the whole conference is recorded and available.
Thank you so much. You have a
Thank you very much. We do intend to make this an annual thing. So hopefully we will be able to have another conference next year.
Thank
All
you.
right.
Thank
Okay,
you.
you
Thank
take
you.
care.
Have a
Thank
good
you very
night.
much.
Thank you so much to
And
all
have a
of
good
you.